Good morning, everyone. We're going to start at about 3 minutes after and give folks a chance to join. Maybe just one more minute and then we'll join. We'll start. Whenever you're ready, Suzanne.
All righty. Well, I think we've got a good group here, so I'm going to suggest that we just get started. And I really want to start with a enthusiastic welcome. We are really excited, Karen and I, about training with you today and about this material. So with that, we will introduce ourselves in just a moment. I just want to go over a couple of sort of housekeeping tips. Chelsea, can we see the next slide? So as always, here we are on Zoom. It would be so nice if we were with you, but we are in our own way. So just, the usual housekeeping tips here. We're going to ask everybody to mute yourself if you're not speaking. We're recommending that we are a large group, so we're recommending that we stay off camera just to preserve bandwidth. When you do go into breakouts, we'd like you to turn your camera on, though, because you'll be with a smaller group. We will have a 2-hour break midway through the training. After the training, we would so appreciate you completing the evaluation that you're going to get a link to. It makes such a difference to us to create trainings that are, meaningful and helpful to you, and to know where we can do better. And of course, everybody always asks, will we get a copy of the slides? So we're answering in advance, yes, you will absolutely get a copy of the slides. We'll be sending that to you after the presentation. All right, let's take a look at the next slide. So we are going to be doing breakout rooms. And I'm not sure how familiar you are with this process, but one of the critical things to making breakouts work is that your Zoom and your audio have to be, and your participant ID all have to be together. So when you came on, if you got on just by phone, we will need you to go ahead and put your participant ID in so that you're more officially in Zoom. So you'll have to get onto, probably if you're on by phone and you're only going to be using your phone today, you'll have to get onto the Zoom app on your phone. If you're on your computer, but from an audio point of view, you joined by phone, what you're going to want to do is you're going to want to go to the part of your screen where it says, actually right now it says mute, but there's a little caret above that. And when you click on that, it gives you an opportunity to go to switch to computer audio. And when you do that, it's going to give you, you'll see here this open thing, a participant ID. And you're going to want to put in your participant ID. It's usually longer than those 2 numbers. It's usually about 5 numbers. You're going to want to put in your participant ID, and that's going to link your audio with the Zoom. And that's pretty important that you do that. So here's what it should look like next to your name. It should have your name and then this little microphone. If it has only your phone number, as it does in this picture here, with the word guest usually next to it, then you're not sufficiently linked in. And what's going to happen is you're going to kind of be doubled up. So one of you is going to go to one Zoom room and the other could go to the other. I hope that doesn't sound too complex. We will help you if you need help with that. All right, let's look at the next slide. Okay, and another thing that we're going to rely on quite a bit is the chat. So probably a lot of you have participated in Zoom meetings at this point, but just in case, down at the bottom of your screen, you will see this little icon that says the word chat. And if you click on that, this box will open up on the right-hand part of your screen if you're on a computer, maybe on a separate screen if you're on like an iPad. And down at the bottom, you'll be able to chat with us, meaning with everyone. Or if you click on the little drop down next to the word everyone, you can chat with someone specifically. So if you wanted to send a message to myself or Karen or anybody else, you could find our name when you clicked on that. You could send us a message specifically. And let's look at the next slide. So we're back to the breakout rooms here. So just so you know, and again, my guess is many of you have done this already. But just to be clear, when you go to the breakout room, when the breakout rooms open, you're going to have the opportunity to choose which breakout room you'd like to go to. You're going to click the word join, and then you're going to see this kind of like little Star Trek thing where you're going to be beamed over to the breakout room. When we are done, you'll see a warning sign that says something like the breakout rooms will close in 33 seconds. And it gives you the opportunity then to return to the main room. You can wait, you don't have to go, you don't have to click return to the main session. It'll actually just bring you right in there. So related to these breakouts, we'll tell you more about the theme of them and all, but one of the things you might want to just think about is each breakout should have a facilitator, a note taker who will also report back to the group, and a timekeeper. So those are the 3 roles that will be important. I like to really, make this simple, but you guys do it however you want. For facilitator, I will say something like, okay, who's the person with the most recent birthday, right? That's the facilitator. Who's the person with the most recent haircut? And that person can be the note taker. But you go ahead and make that happen however you want. All right.
Let me just jump in. Our facilitators just are already pre-assigned. They're going to facilitate the team members selecting.
Thanks.
So, yeah.
Thank you.
Okay.
Excellent. Thank you, Karen. All right, next slide. So now you just heard from Karen. Let me just introduce myself super quick, and then I'm going to toss it over to Karen to introduce herself. I'm Suzanne Daub. I'm a licensed clinical social worker, and I'm a principal here at Health Management Associates. Most of the work that I have done has been around whole person care and teamwork, team care, interdisciplinary teams, and how to make those teams effective. Often a focus of the work that I do is on team leadership and TeamSTEPPS. So I will hand that over to Karen.
Okay. Good morning, everybody. Some of you may have heard from me before. I've been to Yakima several times. I love that part of Washington, Eastern Washington. I am from the San Francisco office. I'm an advanced practice nurse. About 6, maybe 7 years ago, I took TeamSTEPPS training, became a master trainer, fell in love with the communication methodology, and have seen it transform workplaces and organizational structure and communication between teams. And so we're hoping to do that today. That said, normally I'm up there with you doing this work. So we're going to do interactive work. Today it's going to be virtual, so I'm thrilled to be here, and I'm thrilled to be with my colleague Suzanne and your team. I want to actually have a special shout out for Greater Columbia for vision and for supporting this effort. Thank you.
Great. So let me just go over the agenda real quick, and then we will get started. I want to emphasize what Karen just said, which is, we are going to have fun today. We're going to have an interactive fun experience. In order for that to really work, we need you guys to show up. I know that's so hard to do on a long training. It's hard to do on Zoom. Hopefully we're going to keep you engaged, and hopefully you're going to, generously engage with us. So we're going to start with, as we are, our welcome. We're going to describe TeamSTEPPS. We're going to describe the impact of communication errors. We're going to then go from 10:45 to 12 into some of those modules, specifically leading teams and communication. Then we're going to take this break, and on your break, we're going to have you complete this Smalley survey, which we'll explain as we get closer to that. And we're going to have you bring back the results of that survey. Not to worry, we won't take up too much of your time with that. The Smalley survey really is a 10-minute lift here, not a big deal. All right, then we're going to be coming back. We're going to talk about 2 more TeamSTEPPS skills, situational monitoring and mutual support. And then we're going to do some work to pull all that together, do some application, and do the evaluation. So it's going to be a whirlwind tour of TeamSTEPPS, and hopefully one that inspires you and gets you cooking. So I'm going to, at this point, pass it over to Karen, who's going to talk about our learning objectives.
Thank you. I just wanted, before we leave this agenda, you see 2 to 3, there's not much there, but that's because during that period of time, we're going to be talking about your homework or your lunch break work, which is the Smalley exercise and how that fits into leading teams. So next slide, please. So our objectives, really, we got an overview of the agenda, but today for our objectives really for the entire session is we're going to describe, or we hope to make a link between TeamSTEPPS, medical errors, and safety, and ways for you to facilitate reducing medical errors and increasing team cohesion and team function. We will talk about some key leadership attributes of high functioning teams and how leadership is so important to these, and that everyone really can lead from where they are. We will talk about some really important tools that high functioning teams use: briefs, huddles, debriefs, SBAR. Some of you may already be doing that. Oh, my connection.
We can still hear you okay.
You. Someone is, so maybe I should connect a different way if you're having trouble. Okay. Same for me.
It's a little staticky when you're chatting, so I'm wondering if we need to wait.
So you know what I'm going to do? Let me try to turn, switch to my phone.
You do that. I'll continue with the objectives. How about that?
Okay, go ahead.
All righty. Okay, so we're going to describe to you, what does it look like to be a high-performing team? We hope that you come away with a sense of these 3 basic communication tools: briefs, huddles, and debriefs, as well as SBAR and DISC. So that's what we're hoping for in terms of your ability to find them, identify what they are, and how you might begin to use them. And then we're hoping that you'll be able to explain situation monitoring and mutual support to other people, so that you, in fact, will take some of these skills back. You'll be able to describe them to other team members. We can't hear you quite yet, Karen. You'll be able to describe them to different team members, and you'll be able to...
It's not calling me. Let me just try again. Can you guys, is it better now or no?
No, it's still pretty staticky. It's not terrible. We can.
Well, no, I want to make it a little clearer before we get going, because other people may have that problem. So switch to my audio. I'm leaving the computer.
Technology, right? And this has been so interesting to have. Yep, logging off and logging on does sometimes help. It's, I don't know how things would have been if we didn't have this technology, but as we know, no matter what, when it comes to technology, there is always an issue. This one isn't a particularly bad issue, so we'll give Karen a minute to get back on. And meanwhile, if there are any questions, I love that you guys are using the chat. Thank you so much. And if there's any questions or anything you want to add, please go right ahead and do that. Nope. In fact, let's go ahead and let's just keep going, because the next thing actually is something that we're going to ask you to pitch in on. So we're going to do a poll. And basically what we want to just do is get a very full sense of who's here and what your roles are, because it's a large group. It would take a long time to for each of you to introduce yourselves. So Chelsea, if you can go ahead and launch the poll. Great. On your screen, you should see your poll at this point. You can go ahead and just click your role into wherever you see it. If it's other, of course, you can put other. Can everybody see that and use that? Okay, great. And Chelsea, are you starting to see people putting their roles in?
I am. Do we want to give it a? We're about.
Definitely. Where are we at?
We're about 2/3 through all the votes. We're still getting a few in, so we can give it a few seconds.
Yeah, I think it would be great. It'd be great to see who all we have here.
Oh my gosh, almost everyone's voted. All right. Should I end the poll?
You guys. That's awesome.
It's not letting me join by phone. So can you?
Oh, it's better now, Karen. It sounds
okay.
Much better.
All right.
And we actually just launched the poll, so we're going to have a sense in just a minute of the results. So you can go right ahead and share the results with everybody. So
yeah,
we
let's
can all
see. Thank you. Teamwork.
You all see who's here. All right, great. All right, look at that.
Oh,
That's
a lot of people.
Very interesting.
Okay.
Yep. So we have a lot of leaders.
Yeah.
I'm assuming that maybe some of that leadership might also fit into some of these other roles.
Yeah, I think
managers,
so too.
Community health worker, nice, social worker, registered nurse. Very nice. Thank you so much.
Yeah, great. We like to know who's always in the room.
Yep.
Thank you. So I'm back.
Right, now I'm going to toss it back to you, Karen.
Yeah, well, this is how it goes. What can go wrong does go wrong, right?
I was saying something like that myself.
Yeah, just be prepared. Next slide. So this is an overview really of our objectives for this session. Is again, we're going to talk about TeamSTEPPS, the why. Most of us know what we do and how we do it. We don't often know the why about of our work and how communication is so pivotal. So we'll talk about that, the benefits of understanding your team structure and the team structure in your own clinics, and then defining a team. And so many of you on the call, we've got 62 people on the call. Many of you actually did a self-assessment of your organizations, and we've sprinkled that in through the different sections. So we'll be looking at that as we move through this. Let's go to the next slide, please. So I like to use Simon Sinet's golden circle. So as I said before, the why, very few of us know why we do this or tap into it. And that's really what helps teams who have technical training to also have adaptive training, is once they really dig into the why and the shared mental model of the work. The how and the what we'll be talking about, but some of us know that, and everybody knows what we do in our organizations. Next slide. So for us now, it's the why of TeamSTEPPS. Why did we choose this methodology to talk about with communication? Well, it's really been around for about 30 years. Started with the airway industry and NASA, the military used TeamSTEPPS. It's an evidence-based framework to optimize team performance so that safety is up front and center, and that everyone feels empowered. If they see something, they say something. So there are very specific tools that help teams improve their function and how they work together and facilitates safety in organizations. Next slide. So,
all right.
yeah.
I was going to facilitate this. You want to?
Yeah, I want you. I was going to turn it back over to you. Thank you.
Okay, great. All right, so we're going to build that why together, right? Because telling you what your why is doesn't make any sense. So, all right, so Chelsea, if you want to go ahead and just advance this a little bit, grab a piece of paper, everybody. This is not something that you're going to be sharing in its entirety. Some of this is just for your own thinking, but it will help if you can just grab a scrap piece of paper. And what I'm going to do is I'm going to be giving you, this is called 5 by 5. So here's how this works. I'm going to be giving you 5 prompts. And what I want you to do is on your piece of paper, write down 5 things that come to mind for you. This is going to go quickly. We're not going to really obsess over these things. And then I'll take you to the next step. So if you hopefully have got a piece of paper, you've got a pen, and here's our first prompt. Okay, the prompt is, I need the support of my team most when. Go ahead and complete that with 5 thoughts that you have. Why do you need the support of your team? Or when do you need the support of your team? Okay, now let's look at the next one. The next prompt is, teamwork makes blank possible. So 5 things that teamwork makes possible. Again, you guys, you're not going to be sharing this, turning it in or anything like that. What are the 5 things that come to mind? All right, next prompt. Without teamwork, okay, and next prompt, you see we're moving quickly here. Teamwork maximizes 5 things, okay? 5 things that teamwork maximizes. And finally, teamwork reduces. All right, that's great. Let's look at the next slide. So the next part of this is that what you're going to do is now look at your list and circle. Just look at your list overall. It's almost like a big personal brainstorm, right? Start to look for themes. What stands out on your list? And just go ahead and circle the things that stand out. You can take a moment just to do that. All right, so here is the part where you're going to share. Let's look at our next slide, please. What we're going to be doing here is we're going to be, Chelsea's going to bring up her whiteboard. For those of you that are not familiar with the whiteboard, don't worry, we're going to walk you through this. There's her whiteboard, excellent. Now, look at the top of your screen and you're going to see it says, you are viewing Chelsea Chapman's screen. It's in a green box. Next to that, you'll see the words view options with a drop down. And you're going to pick the 3rd option, which says annotate. And when you click on that, your annotation toolbar opens up. The second tool from the left to the right, the second tool says text. Click on text. And now when you click on the whiteboard, what you're going to see is that a text box will open. And you're going to begin to type your things that really stood out for you onto the whiteboard. So yep, there you go. Karen says hello. Suzanne too. So I click on the whiteboard. I click off the whiteboard. Click out of my text box. There we go. Outcomes and effectiveness. Excellent. So you guys are getting it. Teamwork allows more knowledge. And then Chelsea, what you're going to be able to do on your end exactly is move this around so that we can start to see it. This is great, you guys.
It is great.
Yep, just pick whatever comes to mind here as things that you think would be a nice contribution to us building our why together. I love some of these things. Endurance.
Reduces errors up there in the
Reduces
pink.
stress. Yep.
Mhm.
Communication, different ideas. Yep. Increases satisfaction.
Yeah.
Shares the joys and burdens.
Mm-hmm.
Reduces miscommunication. You guys we are preaching to the choir here.
I know
aren't
it. This is going to be
we are
easy,
preaching
huh,
to the
Suzanne?
choir. Yep. Yep. So awesome. So awesome. All right. Now, let me ask you to do this. If most people, it seems like most people have put in their words. If you feel free, you don't have to, just because I'm taking a pause here doesn't mean you have to pause. What I'm going to ask you to do now is go back to look up back to your
Hang on a
annotation
second. We
toolbar.
have somebody who's lost. Teresa says she's lost.
Lost. What does that mean?
Can we unmute Teresa and you can tell us where are you? I can't hear you.
I had no time to write any ideas down, and while I was trying to write some stuff down, I completely missed how to do the whiteboard. You guys left me.
Sorry.
It
was a fast exercise. So, Teresa, we would love your contribution. Are you on your annotation toolbar? Should I start with those instructions?
Yeah, I mean, I was trying to write stuff down when you started talking about the toolbar, and then
no worries. I'm so glad that you spoke up. Thank you.
Yeah.
You're going to go up to the top of your screen, and at the top of your screen, you will see in a green box that says that we're looking at Chelsea's screen. And next to that, there's a box that says View Options. And there's a drop-down arrow. You're going to click on that. You're going to go to the third option, which says Annotate. And that will open your annotation toolbar. And then you're going to look to the second tool, which has a big T, and it says Text. And that will allow you, once you click on that and you click on the whiteboard, you can put the thoughts that you want to communicate right in there. Hopefully that helps.
Got it. Thank you.
Yeah, it was pretty fast moving. Sorry about that.
Yeah.
Sorry for anybody else who was, having trouble with that. I see a few more people putting in their stuff. This is great. It's good that you spoke up, Teresa, because I think maybe a couple other people found this to be a little challenging. All right, this is great.
It is great.
Yeah, this is really great. So these are our whys, right? These are the whys of why we do this work. Teamwork is hard. Relationships are hard, right? Marriage is hard.
Yeah.
It's a lot of work. It's a lot of communication. And having these whys and reminding ourselves, why are we going to all the trouble to do it harder? Wouldn't it just be easier to do it by myself? Well, these are the whys. These are the whys. That's why we do the hard work.
And the truth is, it's not easier to do it by yourself. We think
That's right.
it is, but it's not easier to do it by
It's not, and we get burned out, and we feel alone, and we're stuck with the burden.
Right.
All
you
right.
know what, before we move from this, Suzanne, I'd like for them, because they're going to have to practice this. Let's try the stamp F for them to go.
I was just going to do that, Karen.
Okay,
read my
great.
mind.
We're reading each other's mind. That's
good teamwork. All right, so back to your toolbar. You see the word text. People have got it. Next to that is draw. Next to that is stamp. Open up the stamp, click on that, and you're going to get a bunch of options. Pick whatever you want, and go ahead and stamp one of these that you like, that you think, yep, people are getting it, that you think really speaks to you. Yeah, it's great though. It looks terrific.
I know.
Yep. Yeah, this is great.
Play is so much fun. Learning and play go together.
Yep. Yeah, I see a pretty equal distribution of likes. So what that's telling me is that these are things that are really speaking to people. Y'all
and they're
are
universal
on the same page.
too. They're universal.
Very much so. Even some people like that we said hello. These look great. All right. So what a great way to just for all of us to know, and we're going to talk about this shared mental model later.
Yeah.
But for all of us to know that we really share these very important whys. And I think with that, I think we're good. We can certainly.
I mean, can we save this? Because
I
I
was,
think
yep, I was just thinking we should
I
save
want
this.
this transformed into a word cloud. So we'll
Yep.
do that. And when we send it out to you, we're going to pop this in as a word cloud.
Yep.
So yeah, let's
Yep.
do that.
Maybe we could.
Okay.
Yep. Maybe we could. Chelsea, are you okay to save it? Do you?
Yes, I have saved it, and it will be. I will send it to you after this.
Thank you.
Okay.
That's
thank you.
excellent.
Nice.
All right, and let's go ahead, close our. Yep. Thank you, and back to our slides. All righty. And you can. There we go. All right, now. Karen,
Okay.
I toss it back to you.
Yeah. So as we've just identified, it's a way to address the barriers in team performance. All of those things that you listed, TeamSTEPPS can address and facilitate those things happening through communication. I said at the beginning, it's an evidence-based program that's got over 30 years of experience behind this. For any of you who actually saw the movie Sully, where they landed that plane in was it the Potomac? And I think it was the Potomac River.
I think it was the Hudson.
Was it the Hudson River? Okay.
I could be wrong.
I don't know. Right. A river, someplace
somewhere on the East Coast, right?
Yeah, someplace on the East Coast. That pilot and his co-pilot were actually using TeamSTEPPS methodology. And Sullenberg said that he had been training his entire life and training other people in TeamSTEPPS so that for situations just like that. Now, I know in your clinics, you're not landing planes, but you have similar other types of things that communication makes it so important. So we're hoping to give you a roadmap for creating higher functioning teams, in particularly multidisciplinary teams, because it's hard enough for there are communication challenges if you are trained the same and from the same discipline. But social workers do things different than nurses, and nurses do things a little different than physicians, and community health workers, and admin, and substance use disorder counselors, and behavioral. So it's important for us to have a shared language. Next slide. So we start with, you have two models here. What we're going to start with is definitely TeamSTEPPS addresses performance, knowledge, and attitudes. The knowledge is that sort of I feel, the behaviors, the doing part of it, attitudes, the thinking, knowledge is thinking, attitudes is feeling, and behaviors and skills are what we really do. And so we'll be talking about today that inner circle: leadership, communication, mutual support, and situation monitoring. And really the next one, we'll take all of that information, and what we're hoping is to focus on patient, family, and really the care of the team through those four big areas of work. Now, that being said, TeamSTEPPS training usually happens over 2, 3, 4, 5 days. I took my original training. It was a 3-day intensive. You guys are really getting a taste of this. You won't come out as master trainers. What I'm hoping to do is get you intrigued enough for you to think, yes, this would be of utility in our organization, and for you and other members to really become TeamSTEPPS master trainers and decide that you want to facilitate this and implement this in your clinics. Next slide. So there's challenges and opportunities, right? The challenge is for really having good communication and teamwork. I'm still with you. Can you guys still hear me?
Yes, we can, Karen.
Okay, because everything disappeared. My view disappeared, which is probably just fine. Workforce training needs are a challenge, right? Time, do we have time to really have another initiative? We're in the middle of a big pandemic. Staff and competing demands, short-staffed and people changing, unempowered licensed nurses and other paraprofessional staff. These are some of the challenges. Now, what are our opportunities? You see this list here. You have to have an engaged leadership, engage staff, engage patients. We want to reduce medical errors, improve our safety, and improve patient and staff satisfaction. And so this is really what we're moving through situation monitoring, mutual support, strong leadership, and developing clear and appropriate communication mechanisms and training. Next slide. So when the folks that answered the survey, we talked a bit about team structure, and you see here on the bottom that most of you thought you disagreed with. You see this, there's a strongly agree. Some, it's hard because the darker green is easily to get mixed up with the larger green. But let's look at this first one. It's important to ask patients and their families their feedback. Most of you said yes to that. Patients are a critical component of the team. Most of you said yes to that. I think if our audience were different, some people would be answering different to that. The facilities administration influences the success of direct care teams. There was a little bit of a difference. We had kind of a tie between strongly agree and agree. Some people felt neutral about that, and other people disagreed with that, a lesser number. A team's mission is of greater value than the goals. A team's mission is of greater value than the goal of the individual team. Most of you agreed, and others said you strongly agreed to that. We had some people who were neutral to that. Effective team members can anticipate the needs of their teams. Most of you agreed, and others strongly agreed. We had some people, excuse me, who strongly disagreed with that. So we'll talk about that, disagreed. And then finally, high-performing teams in healthcare share common characteristics with high-performing teams in other industries. Some people felt neutral to that. One of the things we would say is that the team structure and the characteristics across teams are really the same, and we'll learn that a little bit as we move through. Let's go to the next slide, because this is really helping to deepen our why we do this work. Let's hear from Ms. Sue Sheridan.
Looks like I have to open the video up. Just a second.
I want to share with you the story of two very important, very real, and very loved faces in patient safety. One, the precious young face of my newborn son, Cal, and the other, the face of my late husband, Pat. Cal was born a healthy baby boy on March 23rd, 1995, in a large accredited hospital that delivers over 5,500 newborns a year. Cal was first noted to be jaundiced through visual assessment at 16 and a half hours old, but a bilirubin test was not done. Cal's skin was described to be jaundiced again through visual assessment when he was 23 hours old, but a bilirubin test was not done. Cal was discharged from the hospital when he was 36 hours old and was described as having head to toe jaundice, but a bilirubin test was not done. The information we received about jaundice was a simple brochure that never mentioned jaundice could cause brain damage. We were told to put Cal in the window for sunlight, not to worry, and to call the newborn nursery or our pediatrician if there are any changes in sleeping, eating, or any other behavior. On day 4, I called the newborn nursery and told them that Cal was still yellow, lethargic, and was feeding poorly. They asked me if I was a first-time mom, and then assured me there was no concern since sleepiness was to be expected. They told me to unwrap him and tickle his feet, and if that didn't work, to call the pediatrician. We immediately took Cal to the pediatrician, and he noted the jaundice by visual assessment again. A bilirubin test was not done. We were told to wait 24 hours to see if he would improve. We continued to call the pediatrician throughout the next 24 hours, reporting that our child was changing before our eyes. Yet we were repeatedly told not to worry and to wait for 24 hours. At 5 days of age, the pediatrician admitted Cal to the pediatric unit. Cal's bilirubin was tested for the first time, and it was one of the highest recorded bilirubin levels at the hospital. Treatment was limited to phototherapy. Again, we were told not to worry. A resident did Cal's history and physical upon admission, and due to confusing chart entries, documented the wrong blood type for Cal. A blood incompatibility was ruled out. We later found out that Cal's jaundice was due to a common blood incompatibility and was very easy to treat. On day 6 in the afternoon, Cal had a high-pitched cry, respiratory distress, increased tone, and he started to arch his neck and back. These behaviors were all acute symptoms of kernicterus, or brain damage from jaundice. Again, we reported the unusual behavior to the providers and staff, and again, we were told not to worry. Cal was later diagnosed with classic textbook kernicterus. Cal has athetoid cerebral palsy throughout his entire body, neurosensory hearing loss, enamel dysplasia on his front teeth, crossed eyes, and other abnormalities. Today, Cal cannot walk independently, his speech is impaired, he drools, and he has uncontrollable movements of his arms and legs. In 1999, my husband Patrick, who was a face of panache, ambition, confidence, and strength, also suffered a medical error. It was discovered that Pat had a mass in his cervical spine, and because of the size, shape, and behavior of the mass, it was thought to be a slow-growing benign tumor. With the help of our local referring doctor, Pat and I sought out the best neurosurgeon in the nation. The tumor was surgically removed, and a frozen section was sent to pathology. A phone call from pathology to the OR revealed an atypical spindle cell neoplasm, which was understood by the OR team to be benign. The pathologist, however, believed it to be very suspicious and ordered more stains to further define the tumor. 21 days after the date of surgery, a final pathology report was issued as a malignant synovial cell sarcoma. The report was apparently sent to the surgeon's office, but was either filed without the surgeon ever seeing it, got lost, or was misplaced. The cancer was never communicated to Pat, our local referring doctor, or me, and it went untreated for 6 months. Pat's neck pain returned, so we went back to the neurosurgeon to find that the tumor had grown to the size of the surgeon's fist, had spread, and had invaded his spinal cord. Upon removal and a pathology, it was again diagnosed as a sarcoma. Pat's chances to survive his cancer were reduced dramatically by the communication failure. After 7 surgeries, 9 months of chemo, and several rounds of radiation, Pat died. Both Cal's and Pat's errors are examples of simple yet catastrophic systems failure due to communication breakdowns and uncoordinated teamwork. Cal went through several layers of the healthcare system, and each layer failed to stop the succession of error. There was a system-wide failure to include Pat and me in Cal's care. This was not any one individual's failure, but at any point, one individual could have made a difference by stopping the systemic failure before it reached its tragic conclusion. What if a genuine culture of safety that practiced a systems-based approach had been in place? What if our concerns as parents were taken seriously and we were asked to work in partnership with Cal's providers to help identify jaundice symptoms? We, parents, patients, and family members can be additional eyes and ears to spot symptoms. We can be an extra resource to see, feel, recognize, and report changes and concerns. What if the pathologist had given the surgeon a heads up that Pat's tumor was suspicious and that they had ordered additional tests? Or if someone had contacted the neurosurgeon to ensure the receipt of the malignant pathology results? Or what if the pathologist and the neurosurgeon understood the phrase atypical spindle cell neoplasm to mean the same thing? As a family, we are profoundly let down by the very system that we once trusted implicitly. With this in mind, I ask you to never give up on patient safety. Seize it with relentless passion and embrace it with urgency, honor, and hope. While there may be barriers, patient safety cannot wait. I know from my own efforts, each individual can and does make a difference. And I must say that I have witnessed progress, promise, and the power of partnerships since the errors in my family occurred. I have had the honor of being part of some robust patient safety initiatives that are making a difference. PIC, Parents of Infants and Children with Kernicterus.
Chelsea, go ahead and stop. You can stop the video there. Okay. So before we move on, some of you may say, wow, that was 22 years ago. I have other videos I could show you that still these patient safety issues are still happening. And so this is why this is really important. You know, some of the patients that we deal with, the thing that struck me about this video is that many of our clients that we see that have multiple comorbid problems, they're not engaged. This is an engaged, activated family who wanted to be part of a team. And this is what happened with this family. Think of the issues with the people that we serve. So before we go on, and then we're going to catch up in a bit, tell me in chat, what were your thoughts on this? Just write in chat, just tell me briefly, just like 1 or 2 words, what did you think about when you saw this video or heard this woman's story? How, yeah, devastated, absolutely. Frustration and sadness, so sad. How could this happen twice to a family? Yes, heartbreaking, absolute tragedy, stomach upset. Yes, me too, because it was absolutely preventable. And so this is why I actually do seize communication and why I continue to do this work around the country. Next slide. We may think we don't need support around communication, but we do. So here, we're gonna do something a little different. This is called a chatterfall. And in a chatterfall, you use your chat box the same way, but you don't hit send until I ask you to. So the question is, what are the communication challenges that compromise safety in your organization? Just take about 5 seconds to think about that. Don't push it until I ask you to. And then you'll see a whole waterfall of responses once we do that. Okay. All right, hit send. I've given you enough time. Just tell me what you think. Jail, lack of trust, poor handoffs, busy, multiple sites, people not reading policy, attitudes. Celeste says attitudes. 24/7 business, how information is disseminated, lack of transparency, overwhelmed, staff challenges, low staffing, yes, just flat out communication, not involving clients, honesty, oh, that's interesting, multiple offices. So there's so many things that are challenges in the workforce. And I'll say through TeamSTEPPS, a lot of this could really be dealt with. Next slide. So here we go. This is just a visual, right? Here we have on one side, it's the individual. When you're running a race, each of these people are out for their self. My husband's a track and field guy. And so here we have on the other side, we have the handing off the baton. And handing off baton here, we'll talk later, is really a TeamSTEPPS tool that you can use. But that takes coordination and step, and it really takes teamwork. Next slide. So from that shift from individual to team, oftentimes we say we're working in a team, but we really often aren't. You know, it's focused individual, just on our own clinical skills. I remember, you have this list in front of you, but I remember I was going to hire a new staff member in the clinic that I managed in the Tenderloin in San Francisco. And I asked this individual, I said, can you just tell me what teamwork is to you? And she looked at me in the interview. I was in there with 2 or 3 other people. And she said, look, teamwork to me is I do my work and you do your work. Now, we didn't have much more interview after that, because that is approach that wouldn't have fit, right? It's not singularly focused. You know, think about how unbalanced a workload can be, having the appropriate information. Some of these came up even in the problems with communication we saw. So emotional intelligence and internal cultural loyalties, very nice, Celeste. I see that there. Dual focus, you're working on your clinical outcomes and the team outcomes. Total team performance, there's no I in team, it's us together. It's informed decision making. Nobody just goes off and randomly changes things without talking to the team. Mutual support, you see this information, that's the shift that using these skills that we're going to talk about today will help facilitate. Next slide. So high performing teams, and this goes across all sectors, they hold a shared mental model, and we'll talk more about that. They have clear roles and responsibilities. You guys need to think about these things, because we've got these breakouts and you'll be using these skills as you go through. They have a clear value and a shared vision of where they're going to go and where they want to go. There's the resources and the performance outcomes. Those things are managed properly. That there's strong leadership, it's collaborative leadership, but that there's clearly a leader somewhere. And that leader knows what their role and responsibility is. There's a regular discipline of feedback. We don't wait until 2 months later to tell somebody we thought their performance wasn't up to speed or what our expectations were. We tell them in a respectful way right then and there, in a private manner. Develop strong sense of collective trust and confidence. Sometimes people who work individually have trust issues. Maybe they've tried working with the team and they got left holding the bag. So those are things that have to be well defined through clear roles, responsibilities, and then holding people accountable. And that we create mechanisms to cooperate and to coordinate these efforts. Those are what make good organizations great. Next slide. So I'm not going to really read these to you, but you can sort of see this here. And you know, I think we might actually have some time to do this. Can we just go to our options slide here? And can we just briefly annotate here and push, or you can, let's don't do that. Let's don't do that. I'm changing my mind here. When you see these things up here, can you just put in chat, what is the biggest thing in your organization that is a barrier to team performance? Is it hierarchy? Oh, it's workload. Okay. Fatigue or distractions, lack of role clarity. Okay. Okay. Follow-up, conventional thinking. Yes. Okay. Workload comes up a lot. Communication styles, conflict, right? Lack of information sharing, misuse of trust and mistrust, defensiveness. So you see how these are all things that can stop a team from moving forward. And if you implement some of our skills, we're just going to give you a couple skills today that you can help address some of these. Onslaught of communication at all times. Right, right. Okay, next slide. Very good, thank you. If other things pop up, just tell me. So when we think about a shared mental model, and we've actually given you a link that'll take you, you can look at this later, that'll take you, if you really want to dig into shared mental models and how to bring that into your clinic, we've given you some real ways to think about that. But vital, it's a vital but an invisible ingredient of team success. Do we have a shared understanding of what the problem is and what needs to be done? Do we have a clear understanding of our role in this and what our own strengths and areas of challenge are and where we go for help? And strategy, do we have a clear shared understanding of the most effective way? Here's, again, lack of follow through, right? That's accountability. Effective way to approach this, tools and techniques and resources of how we'll be deploying. So once we have a good idea of what the problem is, we bring that to a good, strong team, we come up with strategy. That's really how we have success. Next slide. So shared mental models, and here's that list here, an understanding of the situation, an effective methodology for communication that we all understand when we use the word debrief or huddle, that everybody knows what we're talking about, that we back up those behaviors, right? And that we ensure and we help others and each other with our roles and how they interplay. We understand, I understand what Suzanne does, and Suzanne understands what I do, and we connect and communicate with each other on that. And that when we have a shared mental model, we actually are better able to predict and anticipate a team member's needs, right? All of us are responsible for each other, and that we create a commonality of effort and purpose. Next slide. So we'll talk about whether this guy has a shared mental model. Let's see this. I don't think that's what he wants. That's a bad video, but I couldn't find a better one. Okay, it's perfect. I'm going to turn it over to my colleague, Suzanne. Take it from here.
That is such a funny video. Actually, Karen, do you want to continue on here? I'm happy to talk. I had you slated for this slide, but so I don't want to take it away from you.
Okay, so how about this? In chat, let's talk about that's funny. Tell us how you might think about developing a shared mental model in your
Karen, your audio is
we have bad sound on your end again.
Okay, well then you take this one, Suzanne, while I figure out how to get myself better.
All right, no problem. All right, so let's think about that. Think about your team. Everybody's team here is a little bit different. We have people from all sorts of settings. What does it take? What do you need on your team to begin to develop a shared mental model? Well, how do you begin to do that? Yes, lack of things can go very badly for sure, as noticed here by Audra. Yeah. So clear communication. Thanks, Nikki. What else? What else helps you guys to do that? Teamwork. Yeah. Understanding that that's what we're after. Team meetings. Nice. To build clear goals, clear communication, clear goals. Yep. Meaning the same things with the words that we use. So really thinking about our language and making sure we're all on the same page. Having huddles, clear expectations, assess skills, level of emotional intelligence. These are great. And, Karen had mentioned that, we're in COVID and this is a lot to do. But, in fact, what I'm reading from this list, solid mission statement, right? Are that these are already things. Much of what we are teaching you are already things that some of you are doing. So this is not really an add-on. It's not really something different. These are things that we do every day and that we're going to want to do very intentionally. Having an open mind to other people's ideas, project management skills, a leadership presence as we introduce new concepts. Yep, getting everybody on the same page, clinical supervision. Thanks, these are great. Being intentional is key, it really is. Asking, what are we really trying to achieve? That why, right? And also, and I'm going to have you switch slides now because it kind of segues in, Audra, thank you, to also what are we trying to achieve? How are we trying to achieve it? So the main focus here, and we can see that in the next slide, is we're going to shift over now to communication, which, you know, we've been talking about as the heart of TeamSTEPPS and probably as the heart of most relationships. So for this segment, we're shifting now to a new segment. We're hoping that we'll be able to describe to you, and you can then in turn be able to describe how communication affects team processes, define effective communication, identify communication challenges, identify tools that we can use, and apply the communication tools based on an exemplar. So let's look and see what you guys thought on the next slide. We're coming back now to your survey results. And it seems like for the most part, there was a definite understanding that team communication, in particular communication, can really play a role in adverse events. And a preference, you know, for working with teams. I thought this was fascinating, this last question, or this last comment. It's nearly impossible to train individuals how to be better communicators. And most of you didn't agree with that, but we did really have somebody who thought, you know, that may be nearly impossible. And, you know, communication is tough, but we strongly actually believe that there are tools you can use to make that possible. Let's look at the next slide, please. So in a very simple way, communication is really a process. We're going to define communication, right? It's really a process by which information is clearly and accurately exchanged between people, right? In this case, between penguins. So effective communication, it's not just accurately articulating the message, but it's also skillfully receiving the message, right? Careful listening, and then providing feedback. So kind of a loop here, providing feedback that acknowledges that communication was heard and was understood, right? That loop is critical. What happens? What happens that gets in the way of that loop happening? And we see here these foundational assumptions that we might make. I think you mean one thing, you know, you're saying another. That's a problem. Could be shared language is a problem, or using, you know, how we're taught, don't use abbreviations when we document would be a good example of this, because not everybody knows what you're talking about, especially these days where there's all these text abbreviations. Just fatigue and making it really a challenge, more of a challenge. Distractions. HIPAA, which, you know, is intended actually to be protective, but can make communication more challenging because not everybody has a shared mental model, in fact, around HIPAA. These things, assumptions, fatigue, distractions, are daily. We are working in a very high pressured environment. Many of us are distracted by the gazillion pieces of information headed our way. And, you know, sadly, what we see is that study after study on preventable medical errors that lead to death, show that 70%, sometimes more, of the cause of the error was related to poor communication. And so we're going to emphasize communication again and again here because of that. Right now, medical errors are the third leading cause of death. Medical errors, you know, right under heart disease and cancer. So let's put this in perspective. And Karen mentioned the airline industry, so we'll use that perspective. If this was happening in the airline industry, the number of deaths that occur because of medical error would be the equivalent of 2 jumbo jets crashing every day with everyone on board dying, right? So if this was the case, none of us would even get onto a plane. We wouldn't accept that, but that is what's happening every day in healthcare. So it's imperative that we be able to train people and that we be able to develop and adopt tools and skills that make communication easy to do. So we're recognizing communication's hard. We need tools that are going to make the right thing to do easy to do. So that's a lot of what we're going to be talking about today is what are those tools? Can we all learn them? Can we all share them and practice them together? So let's look at the next slide. So again, communication, this, kind of exchange of information, and we're looking at communication as having several, parts. We have the source of the communication, the speaker, right? The message that's being sent, the receiver, and then that loop, that feedback loop where you're saying, yes, I heard you, this is what I heard. And that is in fact where most of the problems are, is in that feedback. We don't put enough energy into just saying back, this is what I just heard, correct? This is what I just heard you say. And when we don't do that, maybe because of fatigue, maybe because we assume it was said in plain English, everybody knows what we're talking about, maybe because we got distracted, whatever the reason is, that's a big place where communications fail, a huge pit where they go into. And let's look a little bit more on communication. So at the next slide. Okay, great, thanks. So communication is, effective communication, especially in a medical setting, is brief, it's clear, and it's timely. And as you see, these are really not exactly, this one up here, this little brief one, our public water is currently closed because it's not open. The management, right? Not particularly brief and not particularly, it's clear enough, but it doesn't help anybody answer, like, what's going on? Why would that be? People might even be tempted to go right over to the edge there and look in and fall in. Or here we have this like sign. I've seen a lot of these signs actually that are not particularly clear, that do leave us wondering what's going on. So let's go to the next slide. I think you all probably are pretty well versed in communication and in what means good communication, but it can help just to really lay it out. I'm going to toss it back to you, Karen.
All right. So we know we need communication.
Sounds much better.
Yeah. Okay. Thank you. When I'm just going to tell our group here, when we have our lunch break, which comes at noontime, I'm going to figure out how to call in back on the phone because it's doing this every so often. But we're going to talk about leading teams, effective team processes and outcomes, the activities that lead to successful teamwork, describe some tools again, brief, huddles, and debrief. Some of you may be using those. And if you're not, we'll encourage you to think about those when you go back to take this work back to your clinics, and some clinical scenarios. We're going to have a breakout in this session. Next slide. Again, on your teamwork, you can see this is the results of the survey. Most of you agreed that it's important for leaders to share information. Most of you agreed that leaders should create informal opportunities for the team to share. Effective leaders take a view of honest mistakes as meaningful learning opportunities and not punitive. That's really important. You want an environment of safety so that if somebody says that they mess up, that they feel comfortable telling you the truth so that they won't have to think that they're going to lose their job, right? And then the other one is leaders responsible to model behavior. Most of you agreed with that. We have a little kind of a discrepancy here or a diagram here. On this one, it's important for leaders to take time to discuss with their team members the plans for each patient. Some strongly agreed, others said, yeah, they agreed, but we had some people who disagreed on that. And then team leaders should ensure that team members help each other. And so everybody really pretty much either agreed or strongly agreed on that one. Next slide. You've heard us say this over and over, but these are some of the tools that we're talking about. Briefs, that's what we use for our planning. Huddles, that's what we use for problem solving. You guys want to be thinking about these because you're going to be using these tools. Debriefs, it's a process improvement. Oftentimes people only debrief to say, oh, when there was like a big catastrophe or things didn't go well. I believe that if you have a big event or a big busy day at your clinic, in your work, wherever your site is, it's okay to bring the team together and say, goodness, we had all these challenges, but we did really well here. And then check back. We won't talk so much about check back, but we will introduce it to you. It's really that communication loop. Did my intent of my communication, did the receiver get it in the way that I meant for them to get it? A handoff, and we'll be using an SBAR methodology, which a lot of you understand about. Next slide. So let's look, this is our team. We said our brief for forming the team, designating the roles, and just think about this climate and see, this is a short little demonstration of a brief.
Hi, I'm Luz Vega, the interpreter for Mr. Hernandez. Dr. Desai, nice to meet you. Okay, let's brief. This is a 55-year-old man here for shortness of breath who just started having some mild chest pressure. Now, we've already told him that his EKG shows that he's having a myocardial infarction, and we've gotten consent for a balloon angioplasty. Now we need some pre-op information from him. Okay, thanks. Is there anything else I should know? Nothing comes to mind, but stop us anytime and let me know if anything is unclear or there's anything I should know about him that I'm not getting.
Okay, so you see the team was formed there. The roles were designated. We knew who the leader was. She gave a little bit of background, right? And then they went in. So that was their planning for how they were going to approach this patient. Next slide. So oftentimes folks don't like to brief because we do it too long. We take too long. The brief turns into a 2-hour planning session or 15 minutes. And so I've included a list here for you. So who's on the team, what they're going to do, what the roles are, what the plan of care is. That's what you do in terms of a briefing for your briefs. These are some of, you might come up with a different list, but to make sure that it's really a check-off list so that you hit the top areas. Next slide. Let's look at huddle. Before we play it, hang on a second, before we play it. So a huddle happens, you know, if there's a problem, things the clinic is going along or the day is going on along, a piece of equipment, a vital piece of equipment breaks. You might need to pull the team together to explain that to everybody. Maybe 2 or 3 people who you were expecting going to be there in the afternoon didn't show up. Maybe there's an onslaught. This is where you get together to solve a work problem together and share the plan. Let's hear what they do here.
James and Schwartz, how may I help you? All right, feel better, Caroline. I'll pass it on. Excuse me, Dr. James?
Yes, what is it, Emily?
Caroline just called in sick, and she's the triage nurse today.
Okay, do me a favor. Gather up the staff. We will need to do a quick huddle at the front desk before the day begins.
Sure, I don't know what happened. Let me go back to the spot where it was at.
Okay.
So, right here.
Caroline is sick, and she's the triage nurse today.
Okay, do me a favor, gather up the staff. We will need to do a quick huddle at the front desk before the day begins.
Got it, right away.
Okay, perfect. I'll be there in 10.
Okay.
We're swamped today. It's flu season. We don't have time to stand around.
I know, but Dr. James called us huddle. He should be here any minute.
Good morning, everyone. I need to tell you that Carolyn called in sick and she was assigned to triage. So we have 3 providers here today, so we'll take turns covering for Carolyn. During your triage shift, you'll see your scheduled patients every 30 minutes instead of every 15. Any patient you can't see will be passed off to another provider during your triage shift. That way we can ensure that anyone who needs immediate care is appropriately seen. Any questions? No? Okay. Be sure, everyone, to explain to our patients that the wait may be a little longer today, but we're doing the best we can, all right? Thanks, everyone. Let's have a productive day.
Okay, so this is really how you use the huddle. Now, my only concern around this one is it actually demonstrates, wow, it's the doctor who does that. That's not true. Anybody on the team can say, we need to have a huddle and folks need to come together because we've got a shared mental model that if one team member, the medical assistant, could have called a huddle, and then they did team planning. When that word huddle comes up, if you've done TeamSTEPPS training, everybody understands that we need to get together. There's a problem. Next slide. So let's talk about debrief. A debrief is our issue of process improvement. It can occur before or after an event. You know, it talks about team skills, it gives praise, areas that need to be improved. It's an analysis of why the event occurred, what happened. And so for a lot of folks don't do a debrief unless things went wrong. And I am a big advocate that we need to pat ourselves on the back when we do things right. So let's look at the next slide, and then we're going to get an opportunity to practice some of these things.
Okay, let's try this again. Let's take a minute to debrief. First off, great job, everyone. Now, what went well? What can we improve? It was really helpful that Gail told me where to locate the non-rebreather and confirmed how many liters of O2. I was nervous since we never really use it. Maybe we could institute regular trainings to prepare for situations like this. Great idea. I'm glad you used cuss to express your concerns about Mr. Larkin with me. Without it, I don't think I would have sensed the urgency of the situation. It was good that you asked me to bring the emergency cart. We were able to get Mr. Larkin started on the correct oxygen without losing any time. You're right. And Jay, you were also helpful in not losing time. Being aware of the urgency of the situation and offering to call Gail was really good task assistance.
So some of you may think this is a bit hokey. Let's go to the next slide. But this is the work that effective teams use. And I also have given you a checklist as well, so that those debriefs don't turn into big, long sessions. It's just the team coming together and talk about some issues that you talked about: workload distribution, were errors avoided, what really went well, and what they could do better. You had somebody talking about maybe more education so that people were more familiar with certain equipment. There was a tool that they used called the CUSH, C-U-S-H. We're not going to talk about that, but at the end, I'm going to give you guys an app that you can put on your phone. It's a free app. It's called TS 2.0. We'll put it in the chat for you. And you can download all the TeamSTEPPS tools and have them on your phone. CUSP is kind of a step 2 to TeamSTEPPS, and we didn't have a lot of time. Next slide. Okay, so I'm going to get us back on track. So we just want to make sure that we have a closed loop communication, so that, again, we've said it a couple times, The sender gives a communication. They actually confirm that it was received because the receiver accepts the message and gives it back to you. It's okay to ask somebody now, what is your understanding of what I've just said? That's a check back. Next slide. Sometimes what we're doing is we're handing off, we're getting ready to go to lunch. A lot of these, and I want to apologize for this, a lot of these videos and things we're watching are clinic based, but they're all transferable. I'm sorry that we didn't have more behavioral health and long-term care. TeamSTEPPS has been used in theirs, but I just didn't have videos for that. So that I pass the baton is one that I really like because that's where really critical errors happen. A patient has a transitions of care. They leave your facility and go to the emergency room. They leave the emergency room and come to yours. Somebody's going to lunch, a handoff on a project that someone's doing. These are where critical errors can happen, and we have to take special time during that piece. Next slide. We want to make sure that this is, again, about huddles, debriefs, any of these tools. Leaders are responsible for assembling the team and facilitating the team events, but anybody can call for a brief, huddle, or a debrief. Anybody on the team. In TeamSTEPPS, hierarchy really, really is leveled, that all members of the team, if they want to talk about a situation, or if they want to talk about an event, or they see a problem, they have the authority and power, and it's expected that they speak up. Next slide. We're going to do a short poll here. Can you just tell me which of these tools does your team use in a poll? Just get you to answer here. Let's give them about 2 minutes, or about a minute. It really won't take that long. I think, let's see. I think we should be able to pick more than one.
Oh,
Is that, Kelsey, is Chelsea, is that how ours is set up, that they can pick more than one, or do they have to pick one?
it looks like they just have to pick one. I'm sorry.
Okay, that's okay. That's okay. Pick the most important one. And if you have another one, you can pop it in the chat for me. It's only allowing one, so put your other one, your most important one, in the survey, and put the other one in chat. Use checklists. We have people who are using checklists. Briefs
Okay, I'm
and
going to end the
checklists.
poll. We're about a minute in,
Okay.
and I'm sharing results now.
Okay, that's fine. So a lot of you are using briefs. A lot of you are using huddles. Not so much check back, right? Not so much handoffs. So this is really a great area of improvement. And I think some people might have put some things that they're using because they couldn't choose multiple. So this is good. You were doing a lot of this work. Excellent, excellent. And let me ask this question before we move on. Are these tools that you're using, have you seen a difference in your communication style? Has it facilitated better communication among your staff? Just tell me yes or no, sorta, maybe. Yes, okay. Andreas, it's improved communication and accountability. Very good, very good. Do you find people saying, I don't have time to go to the huddle, I don't have time to go to the brief, I don't have time to do it? Do you have staff that say that? Yes, yeah. It has to really become part of the culture of the organization. That's where you find out what's going on for the day. Good. Next slide. Checklists are overwhelming. Oh, okay. We should talk a little bit more about that. Okay. Checklists can be overwhelming. So I talked about this S-bar tool as well. It's a really quick way of communicating quickly. So you're just telling what the situation is. That's the S. The background, what's the clinical background? Not every single thing that happened since the, beginning of time, but just what you need to know for that moment. And then this is where I find people having trouble. They give you a lot of background on a lot of situation. Go back to the other slide, please. But the assessment, they can't tell you what they think the problem is, and they're not good at coming up with a recommendation or a request. This is a practice skill, and every member of your team should understand how to use S-bar. Next slide. So these are essential for leading teams, the skills that we've talked about before. So the leader initiates the team of what the planning process, the team is all included, and they can include pieces in the process. Everyone understands their role and the common understanding of what everybody does. The leaders actually model appropriate behavior. The other thing is that the leader also understands what everybody else is doing they may not have done the job, but they know what their job is. And the leaders also plan and monitor. They do some of the planning and they monitor what's going on with the project. They don't just give a project over to other members and then, only come in when there's problems. Next slide. So they cultivate open sharing of information, and we've talked about this, constructive feedback in a timely manner, and they facilitate this through briefs, huddles, and conflict resolution. I have found that sometimes what happens with really productive teams and actually high functioning teams, that when there is conflict, and don't get me wrong, there's always going to be conflict, there's always going to be things that come up when people and humans are working together, that people are reluctant to provide that feedback in an early, timely manner. So there's a team member who's really not performing in the way that in a team focused way, but nobody ever talks to them about it. And everybody shies away from it. And the leader shies away and the team members shy away. And it just can really have teams can implode because of that. Next slide. So it's important to promote and monitor. Let's look at some leadership styles here.
The Chinese say all great battles are won without fighting. Sorry. Okay? I don't know you.
Just look at the styles.
Let's just calm down. I'm about to beat the puberty out of you. You ain't gonna see it coming. You ain't gonna see it coming. Come on, run for your lives. So it's time y'all show some respect around here. Huh? Carter, wait for the master.
You don't want to be in competition.
How about this? I promise I won't pester you about the DVD. You can defecate in peace. That's a win for both of us. Until this matter is resolved, I would like you to wear this sweater. Would you be prepared on a non-presidential basis to create an emergency ad hoc Slurpee icy equivalency? Oh, Leonard, you know I can't do that. Yeah, I guess we only have one option. Yep, I don't see any way around it. Bye, Sheldon. See you later. They're right, it was the only option.
With my dad, I realized that the shadows coming off those two lamps were in the wrong spots. I think someone tampered with this crime scene. What could do that? Someone smart, someone experienced. Which is why we need to recreate the scene so that it is exactly the way it was when the cops got. All right, fine.
So this is kind of a little funny little video for you. But we're going to now ask you, next slide, we're going to ask you to list 3 qualities of effective leaders that you've worked with in chat. And I don't want you to push it. You see, whenever you see that waterfall, you're just going to put them in chat. I'm going to tell you when to send it, and they're going to all come down. So think about 3 elements, qualities of effective leaders that you've worked with. I'm going to give you a couple seconds to think about that. Don't overthink it, just kind of what you think works. Okay, push send. Let's see what people say. Communication, open-minded, they don't micromanage, they listen, they're good communicators, honest, supportive, enthusiastic. Listener came up really quickly. Joining the team and all they can do, respectful, they have flexibility. Enthusiastic, vision. Nice, nice. Next slide. Able to see the skills, they're goal-oriented. So here's a list for you, and you guys have said some of these things. They're organized, they help to organize, and they are organized. They plan, they can assign. You know, some people don't want to assign or they assign inappropriately. They monitor and modify the plan. They communicate, it's transparent what's happening. Everybody knows on a regular basis. It's kind of that communication 7 times 7 ways. They review the team's performance. They provide feedback and they actually encourage feedback. Someone, Nicole says, willing to listen to others' ideas. Absolutely. They share information. They encourage. They facilitate conflict resolution. They don't run from it. They don't try to, you know, they're not a dictator, but they facilitate that conflicts are worked out through the team. And they do all of this really is done by modeling effective teamwork. So it's really not, it's not what you say so much, it's really what you do. If you value being an effective team leader, then you have to really model that behavior. Next slide. Okay, so now we're just about to be a benevolent, very nice. We're gonna have an S-bar, and this is the S-bar for our breakout session. So you arrive at a clinic for 2 different COVID events, right? And you find the place in complete chaos. You get to your workspace and you're supposed to have 2 events and nobody knows what's going on. The 2 project champions for both events are late. Staff are milling around, they're unclear about what they're supposed to do. Patients are arriving and you know they're not happy. Your organization is planned for an event that includes a COVID-19 testing and COVID-19 vaccination event. So 2 separate events. You have just completed TeamSTEPPS. You're here now, and staff don't seem to know their roles. Testing and vaccination sites are not completely set up, and the patients are getting upset. This is the problem. Okay, next slide. Your job, when you get into your breakout rooms, is to identify roles. There's going to be a lead, a scribe and a reporter, a timekeeper. You're going to have about 15 minutes and we'll send you a message in there. And the rest are COVID staff, right? You're going to briefly review the scenario, assessment and recommendations. You're going to come up with what TeamSTEPPS tools you would best use for this event to get it, set it right back on track and then be prepared for a 1 to 2 minute report out. We're putting this information in your chat, and also your facilitator was going to bring it up on the screen so that you can remember. Okay, Suzanne, do we need to say anything else about the breakout and how we're going to join? Or is
Nope,
that?
I have a deep sense that these folks are very comfortable with Zoom and that they will find their way.
Okay.
This is
So,
Chelsea. Did we want to put up a list of the rooms that were the different types of
Sure.
providers? So we have
Sure,
this
why
one
don't you
here.
which one
with
yeah.
the-
Thanks, Chelsea.
Sure. So I'm about to open the rooms, and so if the audience would please select the room that's respective to the type of clinic you work for, and then we will try to keep an even spread. I am about to open all rooms right now.
Okay, great.
And everyone should see a notification on their panel near the breakout room.
I think you have to click on the icon that says breakout room in order to make that work.
People are starting to move over, so we'll just give it a couple moments.
Oh, no, it's moving a little quickly. It's a little challenging actually, but we'll get there.
If you don't see the icon, just hang tight and I will put you in a room. If you want to say which room you'd like to go in the chat box, I can go ahead and assign you over there if you just want to tell me which room. And just give me a second. I'm moving people as fast as I can, so just bear with me, everybody. Ed, I will put you in room 2. Andrea, I'm going to put you in, you tell me what room you'd like to go into. How about that?
It's so hard.
I know. I would know where I would want to put you.
I didn't even know. I guess you can just, I'll do the hospital clinic.
Okay, room 2, you got it.
Yeah.
Michael, room 6. Sarah, room 6. Nicole, I'll put you in room 2. Brian, room 6. Nursing, I'm going to put you in room 7. We're pretty low in there. Kayla, I missed you. Let's see, where are you at? Room 4, okay. I missed Josh. Josh, do I need to put you in a room? Is this the winning group since you came back so quick?
I think so. I think it kind of helped. We had just 4 of us in our group, so.
Yes, I noticed everyone else ended up with about 12 to 13 people. So your next group I'll probably have to do a little switching around for the second breakout, but. We still have about 5 more minutes if you want to take advantage of this time for
Really? I thought we had
anything you need to do.
How did I miss that? I thought we had to be back at 11:45. I was the timekeeper.
You're on time. I think we're running a little bit behind.
Oh, okay.
Okay, I think we're back in the main session and people are coming back.
Yep, time is up.
Yep, I see they're all coming back. 62, 58. Let's give them another second. 60. I've got a lot of facilitators on here. So the facilitator from group 7, we've got 8 minutes before we go to lunch. We're going to have 3 people report out. So 7, 5, and 2 will report out.
Hey, Karen, actually what ended up happening was groups 1 or 5 and 7 didn't end up with any people. So I'm going to have to do a little switch around for the next breakout room. So we only ended up with 5 total rooms.
Oh, okay. Okay. So that's good. So how about room 5? Scribe and reporter?
So room 5 and 7 are the only ones that didn't have room. So we have rooms 1, 2, 3, 4, and 6. Sorry, I know that's confusing.
Okay,
Karen, I
that's
think
okay.
room 6 is ready to do an SBAR report out.
Okay, thank you.
Yeah. And I want to just shout out, go room 6. You guys did a great job.
Yeah, room 6.
Yeah.
So you want me to talk about it now?
You can talk about it, or you can just say your SBAR, because you guys created a great SBAR. So you can pretend Karen is your leader, and you are going to communicate what's going on in your assessment, et cetera.
Yeah.
Okay, so the situation is that we have 2 events without, we have 2 events, we're short-staffed, we have potential emergent safety issues, and we do not have a leader. Our background is that the 2 separate events, one is for COVID-19 testing and one is for COVID-19 vaccine. And so there may be some people that, potentially are positive for COVID and are anxious and potentially, could pass it to others. So it's important to be mindful of that and use calming skills to help them. Our assessment is this our plan? Am I at the plan now? Yes?
Yeah, so this is great. We don't have to discuss this too much right now, but the assessment was a little hard to develop, given that this wasn't quite a medical situation. But what I heard is, in your report out just now, Melissa, that the assessment is that this is important, that it could be a safety issue, and we need to take quick action. So I heard you give the assessment piece in there, and you can go right into your recommendation.
Oh, so that's our plan, right? What we're going to do.
That's what you're going to recommend to Karen, and she'll let you know, thumbs up, thumbs down, good idea.
Oh, okay. Yeah. I'm going to recommend it. Okay. So our recommendation is to have one staff remain in contact with the staff that are running late to give updates on when they'll be there, to put a few staff in charge of each event. So 2 or 3 staff for COVID testing and 2 or 3 staff for COVID vaccine, to have a staff from each of those groups talk with the patients, keep them calm, reassure them, maybe use some literature to give them information and keep them busy, like pamphlets and stuff. And to assign a person to kind of take charge. I hope I got that right.
You did. So let me ask you one question, Melissa. Which of the TeamSTEPPS tools would you, what a great thing that you did, your team did, is you said, we need some role clarity, right? We need to really assign people to do certain things. Which of the TeamSTEPPS tools would you use to sort of get the ball running? Would you just walk around individually, or how would you do that? Would you use a huddle?
Isn't that, well, we did use a huddle. So that's what we actually used in this little meeting. But I think you might be asking if we would use that briefs, the planning where we
or would you might not would use those. I mean, you might would use the huddle to do all that information? How would you?
We used a huddle. That's what we
Okay.
actually used.
Okay, very good, very good. So I think what I heard in my team and what I'm hearing in team 6 is role clarity, making sure of safety, giving the clients something to do so that they wouldn't get upset, and kind of figuring that out, and making sure that there was a good feedback in leadership until the other leaders came, unless they might not come. Maybe there was a car accident. Maybe they weren't going to show up. Am I clear on that?
Yeah, I think so. I think our main points were we wanted the 2 separate groups because of the potential safety issue with positive COVID, and to have staff available to the patients to reassure them and answer their questions, and that we wanted to assign roles, like assign staff to do certain things, to set up or to be there for the patients or to communicate what's going on to everyone throughout and things like that.
Okay.
That was my understanding.
Okay. So you know what, we only have, I want to be very respectful. We want to get you guys out for break on time. We're going to only do 1 report out. When we come back, I'd like to hear a report out from team 4 when we come back from break. And I'm going to pass it over to Suzanne. Next slide.
Thanks, Karen. And I just want to say, this is one of these great examples of something that seems like a simple enough concept, but really, takes a little bit of discipline to develop. So it's, it's really why we have to practice. Why going to, a workshop doesn't really help you develop the skill that you just run back with. You have to practice it. All right, we got a little bit of fun for you during your lunch. This should not take you more than 10 minutes. You have this, you'll probably need to print it out, but you were emailed it. The instructions here on this little personality inventory is that there are, as you see here, 4 columns. And the 4 columns list different attributes that you may or may not have yourself. And that's the idea. So you're going to say from 0 to 3, 0, I don't have that at all. 1, somewhat, 2, mostly, and that is me very much. You're going to just assign a number to each of these attributes. Add it all up, and then next slide, please. And then on the next page, you're just going to plot it out, just like a regular plot, right? Where you're just going to say, okay, in column 1, which is now labeled the lion, in column 1, this was my score. In column 2, 3, and 4, these were my scores from 0 to 60. And then, you can go ahead and draw a line just like you would with a regular plot. And when you get back, we're going to continue with those report outs, and we will see what your spirit animal is.
Yeah, it'll be fun. And I would love all of you guys to come back, because the next breakout, we're going to be going on a spaceship, an interplanetary trip. So you don't want to miss that one. We all want to go out of space. So we'll see you back at 1:55, and you'll know what your animals are, and take care. We'll see you back here at 1:55.
Take care, everybody.
The survey, I'm sorry, just quickly, the survey's in the chat box if anyone can't find it in their email.
Are we going to leave this open, Karen, or Chelsea?
I'm just wondering, I think we should make, what do you think, Chelsea? Should we log off and log back in, or should we just leave it on? What do you think, Suzanne?
You can leave it open. It's up to Chelsea, of course, but you can leave it open. People can still leave, and then they can log back in. But that way,
I'm going to log out and log back in, because I'm going to come in on my phone. When I come in.
I'm going to leave the meeting open just in case, but I'm going to mute, but feel free to log back in anytime during a break.
Yeah, and you can leave the meeting if you need to.
Yeah.
All right.
See you at 1:55.
Thanks, everybody. Enjoy your break.
Bye. Hello, can you hear me?
Hello?
Hi, can you hear me?
Yes.
Okay, now so now I figured out how to call in. I didn't have the I couldn't see the ID number and everything when I was trying to join from just a computer. So Suzanne sent it to me. Okay, so now I know how to log back in. Okay, thank you.
Yep.
Okay, bye-bye. Actually, I might just.
Hey, everybody, welcome back. We're going to get started in just a few minutes. And Chelsea, I'm just going to check in with folks in a few minutes. So you can stay on this welcome back slide for just a couple of minutes while we check in and see how everything's going.
Sounds good.
Looks like we lost some folks, but I know it's a long.
Yep, they got a couple of minutes yet. Right?
Yeah. I was trying to join by my phone and it worked initially and then it keeps kicking me off. So we'll see what happens this afternoon. But this is how technology works. So bear with me.
I see we have more people joining, so I think we'll just do like we did this morning. We'll get started a couple of minutes after the hour, and
we're assuming that everybody's gone for a nice jog, had a meditation, and relaxed, right?
Took that pause very seriously.
Yeah, they did, which is good because they're working hard.
Mm-hmm.
You know what? I think it's there. No. Oh, well, one other person signing. Okay.
Well, let's go ahead and we're just going to start with conversation actually. So that'll give other people a chance to check back in. I hope everybody had a really nice break and that you were able to kind of refresh your mind or get some things off your plate as you prep for the weekend. We thought we'd just check in before we get started and see how things are going for you, see if this is meeting your needs, if there are things and ways that we can, course correct or, pivot so that it does meet your needs. From our perspective, TeamSTEPPS, like many skills in healthcare, is broken down into sort of a 101, right? A 100 level, 200 level, 300 level, with skills that really span that continuum, some more advanced than others. But our experience is that these skills, regardless from the most basic to the most advanced, are only as useful as, as they are practiced. This is really a practice. And we could see that, right? We could see that if in the breakouts, that, when faced with a situation like we saw in that scenario, it does take time to get your head together and then to figure out how to communicate it. And often in situations like that, we don't have that time. So the more you practice, the more that that's available to us. The skill is available to us. So I'd like a couple of things, just to hear from you guys. How useful has this been to you? Whether there are other things that would be useful since we're here together. Let's start there. Let me ask you to weigh in on that through the chat, if you would. I know there's a lot of leadership on the call. So the question is, thanks, Celeste. The question is, are we meeting your needs this afternoon? Regina, thanks. And so it's just really trying to check in with you guys, see if there's anything that's missing for you, things that you would like emphasized more. And then, as I started to say, there's a lot of leadership on the call. So there's an opportunity here to use this information to trickle it down to the frontline staff, if you think that would be useful. And, I was wondering if you've thought at all about how you want to do that. Okay, Melissa's saying so far she's really enjoying that. Okay. Okay. All right. So I'm glad folks are enjoying it. Or at least, the people that put their thoughts in. Honestly, if you have thoughts for how we could make it better, right now, not only in the evaluation section, but make it better today for us all, we'd be very open to hearing it. One thing I do want to make sure that we get to is, before we go to the Smalley inventory, is I want to make sure we get back to group 4. Because I think group 4 had an S-bar from this morning's breakout. And I was wondering if somebody on group 4 would like to present.
Yeah, Sam was the facilitator on that group. So Sam, who's your lead? And scribe? No, it's a reporter. You had a reporter. Uh-oh.
Regina Myers here. That was
hi, Regina.
That was me. So just real quick, the situation that we had is we had patients arriving to a clinic and they were getting frustrated and our team didn't know their roles for testing or vaccination for COVID. We had 10 staff available as far as background to assist and manage and problem solve this. And we need to structure something to get things organized and get it moving. And so our team very quickly mobilized to make a decision as to which approach we wanted to use. We decided to use the huddle. And our lead was Jesse, our timekeeper was Kendra, and then the rest of us were clinical staff and I was the reporter. So one of the questions that was initially asked was just about roles and prior knowledge, existing knowledge, who might have some expertise in particular roles that needed to be assigned out. We were able to pretty quickly identify roles for each of the staff members. Kendra had a knowledge about vaccines. Matthew was designated to be our management of people and traffic and hand out paperwork. We were able to get Helen to agree to administer the COVID test and be in charge of testing. Kendra then took on the role of the vaccinations and being in charge of the vaccination process. Kayla and Terry then were volunteering for the registration process to get people moving through registration. Kayla did the testing side and Terry volunteered to do the vaccination side. Teresa volunteered to do the testing swabs. And then Victoria, the vaccination administration portion. And then we had Diane working to sit with patients after their vaccine was given for that time frame to monitor them. And then Samantha was collecting all of the samples to prep them for shipment. So we felt like we were able to come to a pretty well-structured solution. And then Jesse was able to be the one to take charge in our group as the lead and make announcements to the patients after the decisions were made.
Wow. I am so proud of you, room 4. That is really, really great. You guys were clear. Suzanne, isn't that great?
That is amazing, actually. It was done, and even just hearing you talk about it, there's so much to deal with in a situation like that, right?
Yeah.
There are a lot of steps.
Yes.
And you captured them all and addressed them. Great job.
Let me ask you this question. How long do you think that would have taken you? You did that in 15 minutes, right? So in the middle of that event that day, you could have pulled the team together and in 15 minutes set it right and made everything okay. Beautiful, beautiful.
Yeah.
Great. It's really great.
Yeah, we had an awesome team.
Yeah, I can tell. Wonderful. Like to hear that. Perfect.
The other thing that, I'm glad you said that, Regina, about the team being awesome, because the other thing that I think it points to is that when you have an awesome team with a shared mental model and, and a clear sense of, a clear charge of where we're going and what we're doing, you can get stuff done pretty quickly, right? Not a lot of,
very nice.
Not a lot of wasted time there. Very good. Well, I hope that you all had a chance. We can go to the next slide now, Chelsea. Thank you for the feedback. I hope you guys had a chance to do a little bit of work with your Smalley leadership style inventory. So, this is not, I don't believe anyway, it's just not an evidence-based tool, but it's interesting. It was developed by Doctors Gary Smalley and John Trent. And it's really just kind of a brief personality assessment, I guess we could call it. It correlates with an evidence-based assessment called the DISC. And the idea here is that most of us, have one or two dominant personality styles. And it can be helpful to know how we're wired, but also how the people that we're working with are wired. So it helps us to gain some insight into our strengths, our challenges, and also the strengths and challenges of the people that we work with, which can, really help you when it comes to TeamSTEPPS. Michael's asking, weren't there other groups in the breakout? Are there other groups that would like to? I thought we had agreed beforehand that room 4 would present, but if there are other groups that want to present, we would love to hear about it.
Yeah, I mean, we have a group 1 and I think a group 3. I didn't know if we were going to have time. Well, let's go through this first, and then maybe briefly we'll call on group 3 and then another group on 1. So
Very
we'll see
good.
if, depending on time. Thank you,
Yep.
Michael.
Thank you,
I know other
Michael.
people wanted to maybe report too, but we might not have time. Go ahead.
All right, well, let's look at the next slide. So y'all did your inventory, and let's take a quick look. We'll take a poll at what the room looks like. What have we got? We have a lot of leaders, so it should be an interesting look. What is your leadership style based on what you saw? I think that the poll is launched, right, Chelsea?
Yeah.
So you can just go ahead and click on there.
Just put it in the poll.
Yeah, just put it in the poll. Just click on one of them.
It's so fun to watch the responses come in.
Yeah.
Oh, somebody had very close scores.
So just pick the one you like the best.
Yeah.
Yeah.
That's pretty scientific, huh?
Yeah, it's not, it's again, it's
yeah.
But that is interesting. It's not super, this is not a super evidence-based thing, but pick the one where you feel like, you know, it most spoke to your dominant leadership style.
Right. And isn't that true of all of us? We're not all of one, and we're often blended, you know, or depending on the situation, you know, what attributes come out.
Mm-hmm.
Yeah, just pick the one you want, the one you're feeling today.
Yeah. How we doing,
Okay.
Chelsea?
I'm gonna go ahead and close it in just a couple seconds. All right.
So what have we got? All right.
A lot of lions here, don't we?
A lot of lions, yeah. A lot of goldens. All right. Well, let's take a little bit of a deeper dive in and take a look at what all this means. We can look at the next slide. That would be great. So here's what they say. This is what the developers say, that the lions, their strengths are, you know, as is true of lions, right? They're the leaders. They're very practical, productive, decisive, independent. So it's interesting how sometimes your strengths can also be, in fact, a weakness, right? So someone who has great leadership ability, steps forward and says, I'm it, can also be very domineering. They can be known to be, sounds like some kind of a horoscope, cold and sarcastic, very self-sufficient, right? And unforgiving, like, you know, I'll do it myself if I can't get it done, and you get one choice with the lion. The otters, on the other hand, are very warm and outgoing and compassionate and enthusiastic and talkative, but they can be very unproductive, right? And undisciplined and kind of like involved with themselves, and they can be prone to exaggeration. All right, let's keep going and look at the goldens. Their strengths are they're calm and they're easygoing and quiet and diplomatic. So this is nice that you have a big cohort of the lions and a nice, you know, cohort of very kind of easygoing folks. You know, their weaknesses are they can be unmotivated, indecisive, someone on the fearful side, a little bit of a procrastinator. And then we have our beavers, right, who are organized and self-disciplined and analytical and, you know, take one for the team kind of folks. And they can be also kind of critical and unsociable and moody and self-centered. All right, so all that's that, right? So, but here's the interesting thing. Let's check out the next slide, because, you know, my thinking here is, okay, but we're talking about people in a team. So what happens on your team if you have too many lions, right? Or too many otters? So, you know, these are just my thoughts at this point, but my guess is that a team with too many lions has got like their hands full, right? How in the world do you make a decision when everybody's sort of competing for the floor and trying to figure out who's going to get control, and then maybe even undermining the other team members in an effort to gain that control? I don't know if this is resonating with anybody at all.
It
How
is with
about,
me because you don't have any followers. If everybody wants to be a lion and wants to be in charge and wants to lead, who does the work?
yeah, yeah, exactly.
Yeah.
Exactly. So let's take a look at what happens when you have too many otters. It's so nice, right? You're such warm, chatty team huddles. There are frequent less you know, there's less of a focus. Everybody wants to contribute. Everybody wants to get recognized, but things can get very diffuse and decisions can take a long time. So if you have too many otters, you've got to really be mindful of how kind of all over the place things can get. And we have Mark saying control is less important than winning. I love that. Mark, I wonder which you are, right? All right, let's look at the next guy. All righty, he's a lion, Bobby says. All right. Roar. Oh, I love it. Okay. And then we have our Goldens. All right. So everyone is so supportive that nobody ever disagrees with anybody else. But the outcome is that it's really hard to make a decision. It's really hard for anybody to kind of put something forward and press go and say, let's do it. And then let's look at our beavers, So beavers can be very worker bees, right? But, in this case, the worker bee might say, this is the way that we're going to build the dam. My way is the way. Or as I sometimes say to my clients, when they get married, the two shall be one. And one of them is usually raising their hand and saying, and I'm the one. Right? So it's this kind of idea of I know how to do it. I know how to build it. We're going to do it our way. And there can be a lot of tension and some difficulty with cooperation with these rather self-sufficient styles. But, you can really see how if you have too many of these folks on a team, you've got a problem. And you can also see how if you have a really nice balance of people on a team, you can really leverage those different qualities. So this is just meant for fun, meant for something to do during lunch, but also a way to give you some insight into who each other are. And it may be a nice thing that you want to bring back to your teams just to see, right? Just to see, whether this resonates with other team members and with their experience. And it may even call out some sort of explanation of so that is true about you. You are a lion or you're such a beaver. I
also think, Suzanne, that one of the things that's interesting is even when we know that this isn't scientific, but when you're thinking about developing teams, to make sure that you have a diversity in personalities and skill sets and all of those on the team, if you know that you've got 2 or 3 or 4 or 5 really bossy people who really prefer to work by themselves, who don't want to collaborate, you probably don't want to pull all those people in on a big project. Mm-hmm. Likewise, people who are laid back, want to, lay in the sun and chit chat and have fun. If you have something that's really important that you need an outcome and a deliverable, you might want to make sure that you've got some beavers, and some golden retrievers, and a few lions on that to get the work moving forward. So.
Very nicely said. And Celeste is saying, that she likes that she's a blend of those two close scores, and it seemed to reflect her well, which is very nice. And you've used Strength Finder and Emotional Intelligence. So Celeste, you've used some assessments, and it can really help people, particularly if you're like, oh, they're so bossy, I hate working with them, right? It can really help the team to just say, oh, so you're the bossy one, right? It kind of in some ways, I don't want to say it de-escalates it, but it diffuses from some of the intensity that people can bring to their role. And you can say, oh my gosh, I know you're a beaver, but you've got to accept some help here. And it gives you a way of kind of just stepping back a little bit and not being quite so attached to your style, if that makes sense. So that's great. And that's all of these things. Strength finders is awesome. Emotional intelligence, amazing. These are great tools. This one happens to be fun and free, so enjoy it if you want. The otter can be a promoter. Yep, getting everybody excited. It's true. It's true. They can be, the otter can be.
And you have to have those people on the team, right?
Absolutely, absolutely. All right, so let's see where we're going here. It was totally fun. I'm so glad. So that's great.
It was fun for me too.
I'll tell you, when
nice way after lunch.
Yeah, after I took this, I actually brought it home and made my family do it.
Yeah.
So that was fun too. They enjoyed that actually. All right, let's look at our next slide. So where are we moving off to here? We're moving into situational monitoring and mutual support. And our objectives here, back to our learning objectives, is to really discuss, of course, and look at how these two elements affect team processes and affect outcomes. We're going to hopefully, at the end of this, you'll be able to explain situational awareness and identify undermining conditions. You'll be able to explore developing a team shared mental model, so we'll go a little bit deeper into that. Discuss strategies to foster mutual support, and then to describe some conflict resolution strategies. All right, so let's dive in. So we have, again, the triangle that we saw this morning that Karen showed, and you see the four sort of cornerstone ideas that are promoted by TeamSTEPPS, and then the skills that fall in. So we looked today, we already looked at communication and leadership, and you see here we're going to get into situation monitoring and support. So, situation monitoring, we'll speak to that for a moment first. Situation monitoring is really the process essentially of presence, in a sense, right? Of actively scanning behaviors and actions to assess what's going on around you, the elements in the situation you're in your environment. So it's a skill that individual team members can hopefully acquire and practice and improve on. This is, again, it's challenging these days because there's so many distractions, but it's really this idea of like being 2 feet in, being very present and watching so that you can begin to identify potential situations, potential issues, monitor sort of minor deviations early enough so that you can course correct and handle them before they become a problem, right? Or before, in fact, they become a safety issue. And the benefit of situation monitoring is that it also fosters mutual respect and team accountability. Because if everybody is monitoring the situation, there's essentially cross-monitoring going on, right? And it begins to build and provide a safety net for the patients, for coworkers, for your team, because everybody's taking responsibility for watching out. So, you might be monitoring things like the patient's condition, malfunctioning equipment, workload spikes, right? You might be seeing, oh my gosh, one of my teammates is very stressed. I happen to know that they're just back after being sick, right? But you're watching and you're saying, can I step in? Can I help out? And you're paying attention. So it's really a way of showing respect to each other. And that then leads us to mutual support. And you'll hear mutual support referred to as backup behavior, right? I've got your back. You'll see that in teamwork literature. It's really critical to performance. When you think about teams that you've been on where you feel like, I really feel happy to be on this team. This is a team I love. Often you will hear this as a central feature. People have my back. They assist each other. They provide and they receive feedback, which is really, a way of helping each other. And there's an assertive sort of advocacy. that you'll see, when, especially if patient safety is threatened. So there's a real like, I've got the patient's back too, right? So if somebody's workload is too, they're overloaded, and you think, wow, this could really, this could really be bad. Think about it as like if somebody's driving and they're really tired, right? And you notice, oh, they're really tired. Let me help out before we have an accident, right? How can I minimize strain? How can I step in? How can I kind of help anybody else from getting overloaded?
We sort of see this, that before we move on, but I sort of see this, Regina says, I've often wondered about that idea, got my back, against what or whom. Could that cross a line to be to a negative? I guess it could, if it's overstepping, but I just wanted to point out what happened at the very beginning of our training. Remember when somebody typed in and said, oh, Karen, I couldn't hear you, and I was just getting ready to go on. My colleague stepped right in while I was futzing around trying to get connected and just kept the ship moving. So I think that, Regina, what I'm going to say to you around I got your back is that you and your colleagues have enough of a relationship that if they say, if they try to say, Regina, do you need help? And you say, no, I don't really need any help, that they're respectful of that. But if they offer it and you do need it, you let them help you, right? That's the difference. I mean, I think bounds or bounds get overstepped when there's a disrespect of the response from the other person. The other person is unwilling to give up when they're clearly drowning in a situation because maybe they feel like people are going to think they're a failure, and the other person jumps in too quick and doesn't hear or listen to what the other person says. So
can I piggyback off that just real quick?
Yeah, absolutely, of course.
One of the things that I've noticed is when we have situations between teams within our organization and they start saying, I need to know you've got my back here. Yeah. And it's in opposition to another team or a collegial relationship. And so that's, I've really had a hard time with some of that, just the language around that, not the concept of being supportive or helping each other out, but just the terminology, got your back, seems to at times almost take on this really negative context when it's between teams. And I've really had a difficult time with that one.
Yeah. That's how, I think that's where I thought you were going. And I think it's a good observation, actually, that sometimes language can take on really different meaning. Like it's us against them, I've got your back, right? So I appreciate that. I appreciate that.
Well, that's why it's important to have a shared mental model.
Yep.
So if your organization is going to use that term, you guys are going to have to define what that means. It doesn't mean that it's my team against their team. It means that we are mutually watching everybody's back to collectively move the organization forward. It's not to say we're better than them or not. So that's where that shared mental model comes in, and real clear definitions of terms come in. Okay.
Thanks for bringing up the thing that happened at the beginning, Karen, because I do think it actually applies here. So Karen and I came into this with a very clear shared mental model. As some of you guys pointed out, we had a very clear, not between us, but pointed out earlier in the training when we were building our why, Karen and I had a shared mission and a lot of mutual respect, right? So when Karen was having trouble with her phone, I was taking over to give her a break. So she didn't have to worry about that. She could take a moment to deal with it, but also because I wanted you guys to have a good experience. So I didn't want the experience to get derailed by Karen having technical trouble. I was able to just step in, give her that help. As soon as she was situated, she could step right back into her role. We knew what our roles were, and we did, of course, we didn't plan for that, but it was just a nice example of supportive teamwork.
Right.
So that's a great call out. Thank you. Let's look at what you guys are thinking. Let's look at the next slide. Next might even be the next couple of slides. Yep. Look at the next couple of slides. So let's take a look at what happened when we surveyed you all. You see the areas of strongly agree being in, you know, people monitoring their emotional and their physical status on the job. So knowing where am I, how am I doing? It's appropriate for team members to offer assistance. Most of you agreed or disagreed to others, of course, if they're too tired. Same with it's important to monitor the physical status of other team members. Most of you agreed. Yep. So, you know, I think that if you look at this, I think most of us are pretty much on the same page here in terms of like, you know, seeing that situation monitoring is very important. Let's look at the next slide.
You know what, before we go on, let's go back to this other one. This situation monitoring also applies to other, like for example, I have worked in organizations where there might be a patient that is sitting in the waiting room for 2 or 3 hours. They're too shy and quiet to come up to the front desk. They've checked in, the front desk has forgotten all about them. They've actually been labeled as maybe not even a no-show. And it's because the front desk wasn't monitoring the waiting room to see that patient A perhaps was too sick or not together enough to say, hey, I've been sitting here 45 minutes. My appointment was at 3 o'clock. Where is everybody, right? So this situation monitoring is scanning the horizon too, right?
Yep.
Okay.
Thank you. Okay, great. Thank you, Chelsea. Yeah. So I think we, for the most part, we see that we're again on the same page here around mutual support, that there is an understanding that it's appropriate to both ask for and receive mutual support from others. It's not a reflection of weakness, you know, and that it is in fact related to patient safety. This can be at times, you know, there can be some tension around this when you see someone doing something, you see that it's not going to go well, right? And you step in to offer support and they say, no, I'm doing fine. You know, leave me alone. So there is skill involved here in both offering and receiving support. But I think you guys are on the same page here with that. This is a valuable activity to do.
Well, and the other thing is we didn't bring this skill to you, and that's why it's important for you to get additional training, because to your point, Suzanne, there are times where you may see a colleague or a coworker doing something that you actually know that is wrong, right? And you try to give them a gentle nudge and they don't respond to it. There is TeamSTEPPS language where you actually use the words, you know, this is a safety issue. And then that's teamed up to stop the person to pay attention. We didn't talk about that today because this is just a baseline, but just for you to know, there are additional tools that you can learn and you can develop and use in your sites.
Maybe that would be like the TeamSTEPPS 200 or 300 level, right?
Exactly. Actually,
yeah.
200.
200 level.
Yeah.
All right, let's look at the next slide. And here we're going to open our annotation bar again and just directly annotate on the slide using your stamp tool. So what this really looks at are, so what are the barriers? I mean, this seems like it would make a lot of sense to have awareness about the situation. What are the barriers to doing that? And we see them here as a failure to do. And you see, these are the things that, you know, get in the way of being aware. So the failure, obviously, to share information, to maintain documentation, to include the family and the patient in there. Choose the ones that you think are probably the most significant. You know, and so we have the failure.
They already got it.
The plan has changed, right? Very new. You guys are great at this now. You're
yeah.
like Annotation experts, yep. Yeah, so we're getting a lot of clustering around the situation. Failure to inform that the plan has changed. Direct information to specific team members. Yep, know and understand where to focus the attention. I see some clustering around including the family and the patient in the communication, where often those are the people that, in non-COVID times anyway, are spending the most time with the patient, right? And also know the patient the best. Yep, so these are the things that can get in the way, and it does seem like we're in good agreement here about where some of these barriers are clustering. All right, thank you very much. Let's look at our next slide. So here's a nice kind of demonstration of this that comes from, let's see if I can clear us out here. Let me just open my, oh, there we go. Chelsea probably cleared us out. Thank you, Chelsea. So here's a demonstration of, of this. It's just in a, in a non-healthcare environment, but kind of fun to watch. If you want to go ahead and start that video, that'd be great, Chelsea.
All right, that's it for today. We have a game tomorrow, so get some rest tonight. Remember, ties and jackets tomorrow. Pleasant. Mr. Cruz, I'm impressed with what you've done, but you came up short. You owe me 80 suicides and 500 push-ups. Please leave my gym. Thanks, client. Gentlemen, see you tomorrow. I'll do push-ups for him. You said we're a team. One person struggles, we all struggle. One player triumphs, we all triumph, right? I'll do some. I'll run suicides too.
Look at that last one.
I do some too.
Under duress.
Yeah. But, peer pressure, right?
Yeah.
Yeah. Me too. I love it. Yeah. So yeah, right. I mean, that's really where it's at is, who's going to step up and who can you depend on? And so I think one of the things we can see is that, mutual support is provided in these very direct ways, actually providing assistance, which in some ways, really contributing to the overall, right? Providing and receiving feedback. We just spoke about that a little bit, but I want to speak about it a little more before we go on. I think if you can do that in a skillful way, being clear and providing feedback can be really seen as a source of support. It can be seen as like, wow, somebody cares about how I'm doing and they want to give me some very direct and clear feedback. And that can also become a source of trust. That can build trust because you can see that nobody's going to really, if it's done properly, that nobody's going to really hurt me in the process of helping to guide me. It's also this whole thing of like advocating and being, assertive when a patient is threatened, which, as Karen mentioned, there are tools that you can use to really practice this. And that can be very hard. But if you're on a trusting team, this idea here that you may have heard before is really a team where you take time and you put the effort into building psychological safety. Over time, people feel like it's okay to assert yourself and to say, I feel like something's going wrong. I feel like something could happen, and I need to be able to just say it out loud, just assert it. And so often when there are medical records and we do kind of a postmortem to look and see, how often we hear, well, I saw there was a problem. I saw that it was going to happen and something was wrong, but I didn't feel like it was safe to say anything. I felt like I would get in trouble. So thinking about ways in small ways to build that psychological safety. A way that I used to do that's really kind of interesting is after a huddle, I would do something that was very simple. I would have a daily huddle, and I would just say, okay, I would do it routinely every day, and I did it exactly the same way. On a scale of 1 to 5, 1 was, boy, this wasn't very helpful, and 5 was, this was an excellent huddle. Tell me how you saw it. And I would not discuss the answer. I would not get into, what do you mean you only thought it was a 1, right? Or, oh, wow, thanks, I'm so glad it was a 5. We would just simply rate how we saw it, and we would move on. And it was a way of just saying, just throw your idea into the ring. Nobody's going to punish you. Very small things like that can begin to build a sense of, I can say something out loud. And it was fairly low risk. I'm just asking, on a scale of 1 to 5, what do you think, right? So these are small things that you can do that begin to really help you build trust. All right, let's look at the next slide. So these 3 things then work together. It's a continuous cycle, right? Situation monitoring, that's what you're constantly doing. You're constantly scanning. How am I doing? What's happening in here in the room? What's happening with the patient? What's happening with my team members? And that then fosters, of course, situational awareness, that sense of presence. I am here, I am present, right? And it then contributes to a shared mental model. And you can also say, we have a shared mental model as our foundation. With that shared model in mind, I am going to be monitoring the situation and looking for something very particular. And that, in fact, is going to raise my awareness. So you see how it builds and it becomes a process. All right, let's do a couple things. First, let's just pause, right? Practice the pause. And I want to do 2 things. I think we're doing okay with time.
I think we're doing great with time.
I think we're doing good with time. So I want to do 2 things. A, see how y'all are doing. And B, see if, what was it, rooms 1 and 3?
It was room 1, that was my room, and room 3. We might be able to get a little report out.
Let's hear a little S-bar.
Yeah.
So how's everybody doing?
Solid.
Oh,
fantastic. Good.
Yeah.
Okay.
Good. All right. Doing great. Friday afternoon.
That's right.
That's pretty impressive.
It is.
That's pretty impressive. All right. Who, TGIF. I'm with you, Kenneth, although I'm having a great time with you guys.
I am too.
This was a long week. I've heard everybody, no matter who I've spoken to. It has been. But a lot of people were like, on Wednesday, they were thinking it was Friday. So
yeah.
Fabulous. All right. I'm so glad. So let's hear from, let's just start with Team 1. Who's the report out for Team 1?
Yeah, that's my
how
team.
your S-bar went. Okay.
Yeah, Team 1, do you know who you are?
This is Teresa here. I think I was the one who was supposed to
Teresa,
report.
I have your name there.
Okay. Really impressed with the last group that went and the plan that they came up with. Ours was a lot of brainstorming and kind of redirecting as far as the plan that we came up with. But the notes that I took, we talked about starting with a huddle, assigning roles to people. Does anybody have experience with the event previously? And who could communicate the needs back to the larger group? What's the workflow? It sounds like maybe the leader didn't collaborate with the whole group, which left the team in confusion, but no reason for us to stand around, sucking our thumbs. We got to get to work and figure out what needs to happen and when. And so that was kind of the process that we came up with.
Very good. And let me ask you this question. We didn't talk about this before, but based on our otter, beaver, lion, golden retriever, what do you think the two champions on that team were? What do you think, who might they have been? What personalities?
Oh gosh, I don't know.
Other people want to help them?
I know I'm a lion. As far as the champions, the people we didn't meet that didn't show up.
Yeah, the people who didn't show up. Yeah, you sort of wonder.
I don't know.
Yeah, I don't know. I don't know. What could they have been? Could they have been somebody who doesn't get, take things seriously? I'm going to be a little bit late. Is that is that one of our groups there?
Otter?
Stuck in traffic, Bobby says. Okay. Stuck in traffic. No, I don't know. Maybe not any of them, just to having a bad day. But for what we did see is that there wasn't a good transfer of communication. So if the leaders weren't there, it didn't seem like the rest of the team knew what the plan was to get it going. An otter, maybe, Brandy says. Could be. Could be. All right. Next, group 3.
So we had a huddle, and our leader, Jill, our trusty leader, kind of figured out what we needed to do. She asked for feedback from the COVID staff on how many patients were waiting. We had 25 patients waiting for testing and 20 patients waiting for the vaccine. So we talked about reconfiguring our staffing ratio. We pulled provider staff from the team to help support the COVID team. And we had our, our provider staff help cover schedules to help get caught up. Our front desk and check-in staff will be communicating with patients at check-in to let patients know that there's longer than expected wait times. We also are sending out communication to the general public about wait times, and then mass communication about any potential walk-ins via patient text, letting them know about the wait times as well.
That's great. That's great. Did you guys find that easy or hard? I find even though people do briefs and they do huddles and they do debriefs, that sometimes in real time it seems to be much more fumbly than it really is. I went and got my second COVID vaccine, and it was at the University of California. You would think they'd really know how to do this, and it really wasn't run very smoothly. There it was long wait times, and a lot of folks milling around, didn't know what to do. How was it for you in those sessions to really kind of think about this hypothetical thing? Did you get organized fast enough? How was it?
For group 3, I think it went really well, especially since our leader who kind of directed us has been instrumental in our organization's COVID vaccine and vaccination clinics. And so I think she has that experience. So it was kind of like a real life scenario that we've been through before.
Okay, good. What about group 4?
I thought it was easy. And I've run like permanent supportive housing with 24-hour staffing, so kind of crisis-y situations. So I kind of like that. I miss that kind of chaos a little bit.
Good.
It's interesting that that's not one of the attributes that they call out on that Smalley thing, but I think it's really an attribute that's common among healthcare providers, which is our tolerance for chaos, right? That we don't get really like unraveled by a lot of chaos. It's almost like you had the picture of the puzzle pieces, right? It's almost like our minds kind of start pulling together. That's what I heard. And room 6, you guys can speak to this, but I heard you guys just very quickly pull the puzzle pieces together, which was quite interesting.
My group did that too.
Yeah.
It's kind of, you better be able to pull it together in our FQs and in community health center. You better be able to really get it together quickly, because things can change in just a second.
Yeah, probably if you don't do that well, you don't like working there.
Right. Now, I don't
so you're
see
sort of
our
self-select.
presentation. Do you guys see the presentation?
We don't at the moment, but my guess is that Chelsea's bringing us
there it is.
right back to where we were. Thank you, Chelsea. She's right on it. Yeah.
She's right on it. Yes. Okay.
Anybody, any other groups want to speak to this, or are we good to continue?
I think we're good.
Right, I think we're good. All right. So we're going to have a little more fun because it is Friday, and this is tough work. So it's good to kind of break it up a little bit. So let's see what we can do. So we have our continuous cycle. All right. So let's think. We have reviewed a lot of steps, a lot of TeamSTEPPS tools. Karen, I'm going to ask you to help me out here. And let's just call out, and you guys can also help in the chat, call out the skills that we have learned thus far, because we're going to try to like pull this together and think about how can we use these skills in this next challenging scenario.
Right. So we have definitely defining roles.
Nice.
We talked about S-bar, situation, background, assessment, and recommendation. We've talked about mutual support, situation monitoring, leadership and leading teams. We've talked about leadership style, the types of leaders, the things, what makes up a strong team, the attributes on a strong team. We talked about that call out and check back. We actually didn't talk about call out. We talked about check back and that closed looped communication, making sure the handoffs were nice and safe, that I pass the baton. Michael reminds me of the debriefing for sure after, the event is over. Yep, Lindsay pops in that mutual support. We talked about having all of those checklists so that the debrief doesn't turn into a soliloquy, that it's, a brief interaction of a planning session. And I think that's it. I think that's plenty. Yeah.
That's plenty. All right. So here's an interesting thing. I'll just say this preface before we go to the next slide. So these skills are used in many industries. Healthcare is one that has adopted these skills. Earlier, Karen spoke of what is it called? When you're the airplane, I don't know why I can't think of the industry.
The airline industry.
Airline industry. Thank you.
Yeah.
The airline industry and the example of, the teamwork that went into landing that plane in either the Potomac or the Hudson, whichever it was. Yeah. These tools are used in a variety of engineering situations. They're used even in the restaurant industry. And one of the major places where this is being used right now is in aerospace. You have to figure out, think about it, all that can go wrong and all that has gone wrong, sadly, on trips into outer space. The stakes are high, and there's more and more interest in being able to travel long distances where teams are going to be together for a long time. They need to both be able to tolerate each other, to work together, and to prepare for very catastrophic events. So, next slide, please. We thought.
So wait a minute. Michael said that. Were you saying to us that McDonald's uses TeamSTEPPS? Is that what you said, Michael? That's great if they use.
I'm not sure, but I'm sure they have times where they need to do the SBAR and debrief.
Oh, I'm sure they do. I hope
Yeah.
they implement it. Okay.
Yep. Yep. Right. In any kind of industry where you really want to have a quality product, where safety is a consideration and where consistency and outcome is really important. And so certainly the food industry would be, that would be the case. Yeah, that's great. Thanks, Michael. All right, so let's look. We're gonna do another breakout, but we're gonna have a little bit of fun since it is Friday afternoon. And we're gonna take some time to travel as a team into to Fantasia. Okay, so we're gonna go back to our same rooms. And here we have a team that is about to board a transstellar spaceship bound for Fantasia. So in preparation for the voyage, the captain of the ship requires your team, so whichever room you're in, you're being sent there by your captain, to together plan for a crisis that you may, you may encounter. So this captain is smart enough to say, before we even launch, let's review what the crises are that could happen, and let's make a plan. And this is not a joke. This is no joke, because it turns out that only 30% of the ships making this trip to Fantasia do so successfully. Many of the ships get stranded on one of the many habitable planets along the path that you'll be taking across the galaxy. So your captain asks that you meet and develop a plan to establish a high quality of life for each of your shipmates should you get stranded and you don't make it all the way to Fantasia. So let's look at the next slide. So what we want you to do is we want you to head on. You're going to go right back into the room that you were just in a while ago. We hope that Zoom cooperates with this. And you're going to be doing the following. First of all, you're going to find a title for your ship. In a sense, a title for your team, right? Have fun with it. And then think about that. What are the roles that you're going to need on your team? You know, what are those roles? What skills do you need? And what skills do you maybe have, right? On your team with the people in the room. Which TeamSTEPPS communication strategies will you put into place for adapting, for surviving, and thriving on your potential new planet until you are rescued? And which TeamSTEPPS activities would you be investing in? What would you spend time on? Because remember, you've got to survive. You've got to find food, you've got to find water. So which activities are you going to privilege as a daily practice? And then what would you need from each other from a mutual support point of view? What will you need from each other to adapt successfully? Those are the questions. I will put them into the chat. You know, you all have, you do have access to the chat while you're in your room. And let's go ahead and break out and see how we do.
And Doug has sent us another video about debriefing. So this is great, a great resource as you take this stuff back to your clinics. Thank you, Doug. Appreciate that.
Is that a long video, Doug?
If it's not long, maybe we can show it.
Yeah, I was just thinking, would it be worth showing now?
Yeah, should we show it now or should we show it when we're, it's 4 minutes. We have time. We're actually doing pretty good on time, aren't we?
I think we have time. I think we should watch
video.
that.
Yeah, let's see if we can see it.
Chelsea, is that something that you can do?
I know, we have a Kelsey and a Chelsea in there. We get them mixed up.
Is that something that you can do, or I think all you have to do is click on the link. Yeah,
let's look at it.
After every flight, the team also goes through a critical debriefing process, which they consider
as important as the actual flight itself. They hash out what worked, what didn't, and no punches are pulled.
We are wide open as we can possibly be to criticisms, and we want to become our own worst critics.
So we debrief everything. I'll tell you how specific it gets. We even debrief the march to our airplanes and the march back. So, and you get picked on for every little thing. And most of us haven't marched in 10 years of being in the Navy. So they get very, very specific.
The debriefing process takes probably twice as long as the flight took itself. Rank doesn't come into play, experience levels. Those are good, but you have to set those aside when the criticism starts to come, because that's the only way you're going to learn the maneuver, and that's the only way you're going to get to where the maneuver looks good and it's safe.
I think I was a little bit late dropping you guys off, so we're a little low going over the crowd. But other than that, smooth air was nice. There was a little bumpy in spots, but we went flying. Glad to be here. But
I'm glad we went flying too. Turned out nice. And I had a couple safeties on the liner breath and left echelon flat pass. Coming over, I didn't acknowledge the go diamond call. It's just concentrating on where I was going and how quick the move was going to be. And I was 20 feet low in the low break cross, and 280 feet, and I could fix all those things.
All these things are called safeties, or things that were safety problems or violations from our standards.
Had safety coming back in. For some reason, I thought we were going right 45s to the park. And then I even called turning left when we were turning right. So it went pretty good for me until we got there. I was just happy to be here. Glad to be here.
We have a term we use, glad to be here. And the term is unpat rating, an average pilot, literally. No kidding, just lucky enough to be in the blues. And that's where the term comes from. The boss say, I'm glad to be here, because there's guys out in the training seat at night, and the Persian Gulf laying on the ship at night, taking care of us. And so I kind of carry a little bit of the fleet with me, so guys can walk around and say, hey, look, it's the Boreals, they represent us.
We have really good tapes, videotapes that we look at, and the tape can be stopped, it can be reversed, slowed, played back, and we do a lot of that, and that's how we get toward the levels of performance that we want. We have two critiquers on the ground that look at the maneuvers and tell us their impressions basically from where the maneuvers were placed and how it looked to them.
You guys did a good job with that placement. Went really well today for the conditions. Glad to be here. Good. Nice one plane looks towards the point and okay so far.
We make these mistakes and we fess up to them, and we do it every time we fly. It's just an extremely important aspect of what we do. What we do after we've said it is, I made this mistake and I'll fix it. You always say that you're going to fix it. And what that leaves the rest of us with the feeling is that you've recognized your mistake and you're going to take corrective action not to let it happen again. So it doesn't drop our confidence level in another person in the formation.
If you don't take it seriously and don't debrief, if you ever get complacent, you're going to kill yourself or you're going to kill somebody else. Now, you got to be able to learn each and every time you go flying, because there's never been the perfect flight demonstration yet that the Blues have ever put on. So we're always looking to perfect it.
All that preparation continues to pay off. And the team wanted to be at their best for the upcoming tour of Europe. The Blues may never fly the perfect air show, but it sure is fun watching them try.
Oh, this is great. Thank you.
You know, thank you so much for that. One of the things that I really appreciated about this, and I think it's well worth pausing for a moment to talk about, is that it sounds like this is very much a routine part of their work. They don't debrief when there's a crisis. I mean, they might, right? But they debrief as just a routine part of saying, how did we do? How did that go? So it's the bookend. On the one hand, you have the huddle, where you say, how are we doing and what's the plan for today? And on the other end, you have the how did we do? And the more we can make this routine, that's what really begins to change culture.
Right.
Right? That's really, it's the doing it. And it's not just saving it for when there's, a critical incident, a sentinel event. We're doing it because It's just a routine part of what we do, how we communicate with each other. And building in, like I said before, thinking about and building in small, low risk ways that you can start to share more difficult or more vulnerable, your opinion, right? More vulnerable communication will serve you in the long run, because then when it really comes down to it, people feel like it's okay. They can say what needs to be said.
And it doesn't sting so much. You know, I'm working with a group that's not used to getting feedback. And it really was just really about a care plan, a kind of a simple sort of a thing to do, very important part of our work. But they were not used to feedback in any kind of discussion from their colleagues about how to make an intervention better, really kind of hurt some folks' feelings. So if this is part of your regular work, you get to the point. So that was in like the first week I met them. And then when we talked about feedback and started making it a regular practice, when I had a call with them just last week, somebody actually said they presented their SBAR and then they said, can I get feedback from my colleagues? So they were asking for that feedback. And so this is what we want your teams to be open enough, feel safe enough that feedback can easily be given and it can be received properly.
It kind of comes back a little bit, Karen, to this, personality style. Like if you're a lion, you may have a little bit of work to look at and say, do I make it safe? I mean, the teams need lions, right? There's no question, every one of those, you need that lion. But to really be asking, on the other hand, am I making it safe for people to say what they need? If you're an otter and you're like swimming around and having a great time and contributing, really fantastic, same with, the Goldens, these really lovely energy, you have to also be asking yourself, am I showing up for my team? Am I contributing? So that's, and we talked about some of the other inventories that were mentioned earlier. It's the same thing. Know who you are. Encourage your team members to know who they are. Anything you can do to build that awareness is fabulous.
Yeah, thank you. That's another, we'll add that to our arsenal of videos. Thank you.
Yeah, that's a really good one. Thank you. All right. So here I put in the chat your task. Good luck on your planning. Make sure again that you have a timekeeper.
That you know which room you're going to join.
I think you're going to be put, that's what we learned earlier. You'll be put back in the room.
Back in the same room, okay.
And then some folks weren't here in the morning. You'll be able to pick a room. You can, you can just say which room you want to join. And by clicking on the breakout when it comes up, clicking on the word breakout. And so you'll have your recorder and that'll be the report out. You'll have a timekeeper.
And a scribe.
Yep.
And a lead.
All right. And a lead, yeah. Okay.
Take us
away. Ready? Yep. Break us out.
Here we go.
Beam us up, Scotty.
Yeah. We're on our way to Fantasia.
So you see that little breakout room thing is highlighted, and then you can just join whichever room is right for you.
And if you need help with a room, just put which room you'd like to go in. We have a couple different ones. All right, Matt, I'm getting you in room 4. Regina, room 4. If you are having trouble, you should hopefully see a breakout button on your panel. And then if you click it, it should provide you an option to join a room. If not, if you'd like to put a room in the chat box, we have 1, 2, 3, 4, and 6. If not, I will just start assigning rooms. Okay. Kayla, room 4. Stacy, I'll just throw you in a room. How about room 3? 3. Brian, room 6.
I'm not sure. Have we lost our audio?
Hello. Hi, we are actually in breakout rooms. Are you, looks like you might be tied to.
Yeah, I was on earlier. Sorry, I had a clinic emergency that I had to step away from.
No problem. Are you able to, Ashley, are you able to join a room based on the breakout room button on the panel?
Was it the same breakdown as last time, as this morning session?
Yes, if you can go to that same room, that would be great.
Okay, perfect, yeah.
Awesome, thank you. Hello, is there somebody else still on the line? Switch it over.
They're coming back. Hang on.
Welcome back, teams. I think we've probably got everybody back. Is that right?
Got about 52 back, yeah.
All right, excellent. And I see we already have team 1 saying we want to go first and report out first.
And that's going to be, Caroline is going to be our reporter, and other people are going to chip in if she needs help.
All right, Caroline, you ready?
All right. Thank you. I am first going to ask Mark Lowe's to introduce our ship to you.
That is awesome. So you have to be a little bit mature to get our ship. It's the Ina Gana Davida.
Ah.
It's a mouthful.
That was so we could spend a lot of time saying it if we were frightened. So the first thing we did in our huddle was we had our leaders. We had Teresa and Mark was the co-lead. And we spent some time talking about the roles that we would need and the jobs that people would be doing. So we figured we would need a doctor, obviously, to look after the health of people. We would probably need a scientist to assist us in wherever we were living and what might be a barrier there. We would need botanist, agriculturist, some kind of farmer who was capable of figuring out how to grow food and harvest food. We would likely need some engineers or mathematicians to possibly repair our ship and help us get us back on track. We felt that we would need a lot of collaborative efforts. We were going to do some regular check-ins and regular debriefings. We felt that our leaders ought to be able to instill confidence in the rest of the people to keep people calm and safe and to reassure people. A lot of cross-training and collaboration in an environment that may or may not be conducive to living well. The loss of a team member could be detrimental to the rest of us. And so there needed to be some real strong planning and cross-training so that every member felt confident to take on another role in the absence of someone else. We also felt that the strengths would be to really have just a common interest and shared goals. So that was what I noted. I would love to have some of the team members chip in because we had a lot of information and I probably missed something.
Anybody else want to add anything? I thought we said we were gonna, somebody said something about entertainment.
Oh, wow.
Oh, we did. We felt we would, yes, in the event that the planet we land on has a dark time, we didn't have any lights, we might need some form of entertainment to just keep morale high.
Very cool.
Yeah. We can go to the next group.
Who would like to go next? Are we back, Chelsea, to what's the breakout look like of teams of rooms, Chelsea? Do we have, how many rooms did we get?
We could do room 2 next. If we just want to go in order, we have room 2, room 3, room 4, and room 6.
Okay. Room 2, are you guys ready? I kind of voluntold you here, but if you're not ready, then we can certainly go to room, I think 4, is that right?
Room 2 is ready.
All right, room 2.
All right. Well, we named our ship the Minnow.
Ah.
And before we even started on our space trip, we would want to pre-plan and figure out what we had, what was on our ship, and what was available on each planet before we even left. So if we had to stop at a different planet for whatever reason, we would have some idea of the resources that were already available to us. The roles that we decided in our team, we needed a clear chain of command, a captain, first mate, and then the crew. And I like that team 1 got very specific with like botanist and engineer and stuff like that. We basically just looked at Maslow's hierarchy and talked about, food, shelter, water, medical, that sort of thing. Our first priority, probably after we landed, wherever it was we landed, would be to huddle to prioritize what we needed to do first. We would be using some mutual group mindset and goal setting, closed loop communication, mutual respect and feedback, obviously that clear chain of command like I talked about, and then lots of huddles and debriefings to establish group goals. And I think that was it, unless Team 2 has some other input.
All right. I like that you guys are very attentive to life on this other planet, you know, that very attentive to like preparation and then how are we going to survive and thrive. Very nice.
Right. I love that somebody said relaxation and entertainment, because that actually is very important to our mental health.
Yep.
Very important. Yes. Mm-hmm.
All right.
We have another team.
We have team 3, room 3.
Hi there. So room 3, we named our ship the STS, which is Super Team Spaceship. And we started by we're dividing roles, but in doing that, we also talked about what skills we needed. So we built a crisis team that would have some kind of weather specialist, a navigational officer that could figure out where we are in space in conjunction with other planets, a nurse or a doctor, some kind of engineer who could help us rebuild our ship, the captain, obviously, and then some kind of botanist or food water specialist, a habitat specialist, somebody who could help us build shelter, and then explorers, people to go out and look at the planet and see what's out there that we can utilize or that we should be worried about. Communication strategies, we talked a lot about briefing and debriefing, doing huddles both at a team level and then also with a larger group. We wanted to set clear future goals and have clear visions and plans, use the S-bar, and also identify different leadership styles and strengths and weaknesses so that we could work together better as a team. And then we thought that we would definitely need mutual support from each other. We would need flexibility, communication, mindfulness, and a commitment to a culture of making it a safe and habitable planet.
Very nice. Very nice. All of these are great. Every time I hear one, I hear some other thing. So that's good. Uh-huh.
All right. We have rooms 4 and 6 to go.
4 is ready?
4 is ready.
All right. So we had gone with the Fantasia theme and titled our ship Night on Bald Mountain.
Oh.
We had a great group of talented individuals who were asking a lot of really good questions in the beginning and ultimately landed on several roles. Captain Kendra would be at the helm of the ship. We would have construction expert Terry. Consumable goods collection expert would be Diane. Excavation expert Matthew. GIS tech navigator would be Jesse. Supplies management would be Sam. And our water resource tech would be Kayla. And then we would have Doug as our farmer and grower for our team. We would need specific skills of engineering and someone to help with sustainable food and water resources for survival. We would use debriefs, huddles, and S-bars on a routine basis as appropriate throughout the day. The debriefs would be at the end of the day to see how the day went. We'd do some huddles in the morning and do the S-bars throughout the day as needed to help with problem solving. Activities that we would engage in: routine information sharing to keep communication open, and engaging in regular research and assessing situations as problems may arise. And what we needed from each other was open communication. Humor was one of the things that we decided we really needed to focus on for health. Accountability, support for the team, maybe even over our own individual needs, and putting the priority of the group survival ahead of individual stuff that might come up. And then flexibility was also important.
Very good. Very nice. Very nice. I wanted to throw this in before we hear our last team, is how do we assure that all the supplies and that everyone on the team is treated equitable? How do we assure that the work and the respect is equitable. How do we do that? And do we need to think about how we would solve disagreements? Because you know, when tensions are high and people are stressed, even in the best of situations, there's always going to be some kind of conflict. How do we do that?
I think one of the things that you can use is the leadership styles that you just mentioned, that we just went through that exercise and kind of identifying our personality types. Those can really leverage some positive communication in that way. If you talk about the strengths and weaknesses of each style, then it's a style issue, not so much a personal issue when you're talking about overcoming obstacles. You say, well, your style and approach to this may tend to be this way, and this person's is this way. And maybe that's where the conflict lies, rather than between two of you personally. It's a stylistic approach issue. That's sometimes quite helpful.
Right.
Very nice.
And I also think by implementing regular debriefs and really supporting a culture of feedback, that also, that people don't feel like they're being attacked. This is something, you know, what went well, say what it is. And it would have been better for me if I had known about this sooner, then I can change my behavior. I loved how on our aeronautics video, each of them were saying, I'm going to take responsibility for the errors that they made. People said, oh, I made a mistake in X, Y, and Z. And I'll make sure that I don't do that again. So they owned up to what they had done. Because my question is, one of the things I threw out to Team One is, how did we even get off course? We were on our way to Fantasia. What happened? Obviously, whoever was driving us may have taken a left turn, or we didn't have enough gas, or something happened. So that might be something to think about, is how did we get to Fantasia? And once we get this ship going again, we want to make sure we get on our way. So sometimes that's always good too, to do a debrief and talk about what went wrong so that you can make sure that you're moving forward. Okay, our next group.
So that was Team 6, and we are the Guardians of the Galaxy. And for our roles, we decided that we needed a pilot to fly our ship, a navigation specialist, a biologist, a chemist, mechanic, a medic person, and let's see, we all wanted to eat food, so we needed a cook, but we didn't think about water, so that was going to be hard. And a janitor, let's see, security, a communications specialist in case we run into aliens, a psych person or a counselor, and a leader governing body. Let's see. Some of those skill sets kind of mimic the roles that we picked. And then communication strategies, we decided that huddles and debriefs and briefs were a good idea. Handoffs for shifts, we talked about like going into shifts and understanding who was going to take over roles for the next shift, and making sure that there was feedback and mutual support between each other. We talked about camaraderie, feedback to each other, and support.
Great.
This is, you know, I think what really came through in these debriefs, which is kind of what we just had, right? These report outs, is how creative you all are. And I love that some of the teams incorporated that, like, you know, we would need a stand-up comic, right? You know, that there's just a high level of understanding of like whole humans. That's what really came through, right? A kind of like whole human. What do we need to thrive?
Right.
Excellent.
So one of the things, and let's talk about that, Suzanne. Suzanne and I are gonna have a private conversation with each other in open with all of you guys on the call. So we're going to admit that we have, which is wonderful, we have a very diverse team on here. We have people from behavioral health, we have people from substance use disorder, we have medical folks, we have leadership, administration, all of that. But one of the things that a lot of the context and the scenarios that we've brought forward have been sort of healthcare and clinic, medical, biological, medical related. I want to hear from some of our substance use disorder and our behavioral health people. What are some of your challenges around communication, and how might some of this fit into your work? Let's hear from some of you guys. We have some time. We probably will get out a little bit early, but I want to also make this meaningful for you in different sites. Maybe you don't have primary care. You have some other service that you're providing for community.
I'm a administrator for a behavioral healthcare agency in Walla Walla, and one of the things we do, a lot of the things that you're talking about, we do a lot of that training for our leadership and our staff. And one of the primary issues we have is communication for our treatment modalities with primary care and other doctors in the community. And so that's one of our areas to overcome is having care teams that truly wrap around the client and not siloed services within the community. That's one of our challenges that we're trying to deal with.
The other thing that's interesting about that is that you have team members that you don't work with every day. They're not on your site. There's a sort of a virtual team almost. So that's an interesting challenge.
Yeah, that's why it's really kind of fun. I've worked with organizations where, Regina, to your point, they've actually done these kinds of team one-day trainings with the folks that they're working with, and that they team them up with, it would be, you know, primary care and the other groups actually working together through a TeamSTEPPS module to teach them so that they learn to work better together, or to think about how they can facilitate their work. That's actually really an important piece. It makes it hard. You might be doing TeamSTEPPS in your clinic or in your organization, but if the people that you're interacting with aren't interested or don't have the same shared mental model of how we communicate, it can definitely be harder. Anybody else want to share something? Well, let me throw this out then. During COVID, how has COVID affected how your teams work with each other?
This is Celeste. Hi. I think that especially during COVID, our team came together beautifully. I think that we did a lot of huddles. We did a lot of briefings and debriefings on the fly very quickly. We quickly had to assess what changes needed to be made in the program. And we knew, because we did those other assessments I talked about before, the 2.0s, we knew whose skill sets we needed to go where, and to further enhance the movement of being proficient in every step that we made on the protocols. Mark Lowe's, he did an amazing job on creating our protocols and policies during that time, and we had to enact them immediately, which our staff, we had to really do encouraging, do some incentives, to not incentives to make them do it, but incentives to let them know we see the hard work you're doing. So being able to recognize and to pull on the strengths, as well as knowing where we needed to place people during that time, was very key. And trainings immediately. So knowing how to best put who needed to go where at what time. And we didn't always have any warning. And so I think the communication was heightened, and they did a great job. So
Okay. So thank you. So you know what I see, Audra says, sometimes communication is hindered by generalizations and stereotypes. Sometimes we just don't speak the same language. Audra, can I ask you to unmute and say more about that? I think you're still muted.
She doesn't have a microphone, it says.
Oh, she doesn't have a microphone. Okay, all right. I see Doug says face-to-face communication is so much more effective. The learning curve for virtual meetings was very expansive. Yeah, yeah. Doug, do you want to say a little bit more about that?
I think I'm on. I
Yeah,
apologize.
I can
there
hear
you
you.
go. Yeah, you can hear you.
Yeah,
Yeah.
it was just so so disappointing to us, the ability to have the huddles and whatnot with the we're in a skilled nursing facility, so there's such great restrictions to gathering around and being face to face. We just lost a lot of ability to have that quick communication with the team and ability to understand what we're doing. So we are actually now at a point of trying to forbid the word COVID and try to overcome that and find out ways to do it. And thankfully, slowly we are moving, of course, into phases that's allowing some lessening of some of those restrictions.
Okay. Yeah, this has been a really, really hard time. I've heard some teams say that they were able to pivot really well, but other teams have had lots of issues, and it really makes it really hard in areas where it's rural, that everybody doesn't have the same kind of technology. Not everybody has good connections. I'm in an urban area, and today I've had all these difficulties with my tech. So I know that sometimes it's really, really hard. Somebody typed in, they've done better with Zoom, but they don't always feel comfortable sharing. Yep, it's really, really hard. Or always feel comfortable having their pictures or on camera, or they don't have the camera, or we can't all be at the same time because we don't have the bandwidth gets messed up. Let me see, there's a nice one here. Mark says, we did a voluntary leadership campaign over a year based on John Maxwell's material, had 25 staff join the group, and we met every month for a year working not only on Maxwell material, but projects and activities outside the organization. It was incredibly productive as we had staff from every department. Good. One of the coolest experiences I've had as a leader, watching people learn and grow. Mark, tell us a little bit more about this Maxwell material.
Hi, it's pretty well known. I mean, it's similar to the material you're presenting. He's a little churchy, but I think people tend to like him and connect with him. So we did a lot of videos, and then there was a workbook and another book that we read. The cool part was we had the CEO and the COO, but we also had housekeepers and people from the kitchen staff and clinicians, and that was probably the neatest part. And meeting in a group that size, watching people, especially the first few meetings, that were obviously uncomfortable being in that situation, being in front of myself and the CEO. But then as the meetings progressed and they started kind of coming out of their shell, becoming more comfortable, I think the material helped with that, but just being part of the group helped. And we did a couple really cool community projects with like, went and fed homeless people and just did a bunch of really, really cool stuff. But just watching the growth and change in some of the staff was incredibly rewarding. And then we did a follow-up kind of advanced class the next year. And then this last year, the third year, the group basically worked on their own and rebuilt our whole website and kind of took that on as a project. So
wonderful.
It's just awesome.
So let me ask you a question. Sometimes when people go to trainings or even go to things like this, and it's great today and everybody's kind of enthused about it, but then when they go back, it kind of all falls flat. How do you think about how do we embed these kinds of things? How, we're going to, at the end of this, we're going to ask you which of the skills might you take back and what might you embed? How do you make sure that the learnings from today, the learnings from other trainings that you have actually get embedded and passed on to other members in your organization?
That's a great question. It's the hardest thing. So the follow-up is the hardest part. So you see the energy and you see the commitment and connection, and then gradually you can, especially older organizations, you see that culture come back and kind of force out the new stuff, or the innovation gets forced out, and we kind of get back to status quo. And I think that's one of the hardest things for organizations to overcome, is to kind of keep stuff fresh. I think that's why we kept doing it each year, and just kind of added a new piece to keep it in their minds and our minds, because the communication definitely improved with that. I think the interdepartment communication, especially, because just being part of the group, these connections were made. Whereas, I might work with somebody for 20 years, but I've really not spent much time with them because I just don't work in the same department. And there's really no work-related issue for me to have a direct interaction with them. So it really helped with those things. But I think that is definitely the big question, is how do you continue to move it forward and keep utilizing it?
Yeah, I think that's true. I think what you're talking about, and Suzanne, you chip in here, it's the difference between technical and adaptive learning, right? Yep. Adaptive learning is that why, where it's not even thought of as training anymore, that it's just the way you do business, right? It's the way, culturally, the way you are, right?
I'm frequently described as a robot, so I'm probably more of the analytical type.
Yeah. So yeah.
I like what Celeste has written here. Actually, Celeste has written a couple of interesting things.
Go ahead.
But she wrote here, loyalty to culture is at times a barrier to new and innovative, even necessary changes. And I think that's right, that we want these changes to become part of your culture, right? But then in this interesting way, they become part of the status quo. And there really are times when, in order to grow, you have to be able to creatively destroy, we'll say, right? The culture that you have in order for new growth to occur. And that can be very hard. It sounds like John has done this really nice job of doing that progressively over time, but it's a long haul beyond today, right? Of course, we all know that, but keeping it on the front burner is hard.
Yeah. Can anybody on the call share a situation or a change that they were trying to do in their organization that communication was really what sunk the project? And
or lack of, so
you've learned today that may have changed things if you'd known about it? What or if you've seen
or
it
if
happen?
Applied them, yeah.
Yeah. You want to share anything with us, or Suzanne, if you have anything to share, a situation?
I'd love to hear from others before I share. That'd be great. Yeah.
So it sounds like everybody's projects are going swimmingly.
I was just going to offer, I think some of the times the hierarchy of the organization is our biggest barrier. When something at the direct service level needs to get communicated upline and get approved, and then it has to go through the approval chain of command, and then as it gets translated up, or if there's a message from leadership that needs to get translated down to direct line staff, the message gets diluted in translation as it goes from team to team to team, and it's not as effective by the time it gets to its destination. I think those are things that we notice a lot.
Interesting. Bobby is asking, can I repeat the question? And the question was, can you share a situation or a time where there was a project or a change or some kind of initiative that you were working on in your clinic or the organization, and it just fell flat because of communication? Well, Brittany says, while I was doing my MBA program, a group project was very frustrating. Knowing now about personality types, I think we were all lions. Okay, Teresa says she's going to share. Okay, go ahead, Teresa.
Well, I think the last year, the whole COVID thing has really highlighted how easily communication can break down, especially if you have, if you don't have the ability to be on site with people and looking them in the eye on a regular basis. It's so easy to, take directives that come by email or phone calls and say, I'll get back to that. I'm going to deal with this thing that's in my face right now, as opposed to the things that are on my to-do list. And I think it's just, for us, it's just really highlighted the need to be present with each other. And then the challenge of how can you be present with people when you can't be present with them, physically present with them? What does presence look like in other ways? And we've had to really shift and change our models and show up in different ways for each other. And it's exhausting. I think it's exhausting for staff. It's exhausting for leadership to figure out how to navigate it. And it will be really nice when we can move, out of this phase that we're in right now. And I don't mean the government phases. I just mean this time, this cultural trauma that we've been going through, and get back to actually connecting with people. And I think we've learned how to connect with each other in ways that aren't physical, but it doesn't compare. I don't think that physical presence can really be substituted, not for this long.
We're social creatures, aren't we?
We really are.
Yeah, we need to have people around us. That's for sure. Well, this has been really great. Suzanne, do you have anything else to add, or shall we go to the next slide?
I think let's move ahead.
Yeah.
Thank you, everybody, for sharing.
Yeah, you
I
guys
echo your comment, Karen, and other people have said the same to me, that if we can curate some examples from behavioral health, from substance abuse, I think that will enrich our understanding of how this applies.
Yeah, I'd love to hear from a substance use disorder, behavioral health, mental health. I'd love to hear from you guys about how communication, you're facilitating that with most of your visits being on, or even with your teams and with your patients. So please share with us. I want to talk to you a bit about the next steps. So this is just the beginning of the TeamSTEPPS training. I mean, there's all kinds of communication skills. If we were to dig in deeper around communication, we would talk to you about the 2 challenge rule. Sometimes if somebody thinks somebody's doing something wrong and they ask them and they continue to do it, that they challenge them a second time to just make sure that they've heard, right? That there's terms that you can use, like the cuss term. I'm concerned. I'm uncomfortable about what you're doing. And then finally, this is a safety issue, right? And that we have to talk about this. And that can be from staff, staffing levels, or how the COVID clinic is set up or not set up, or how the vaccinations are being administered or not being administered. And then one of the things that's really important for you, if you were to move on and go on and to become master trainers yourself, is conflict resolution. How to do that in a non-defensive way that people don't feel like they have to protect themselves, is to use a beautiful system called DESK. And that's where you describe the situation, you express it, you suggest what could happen, and then the consequences of that. So these are all things that you can learn if you fully get trained with TeamSTEPPS. And I want you to write down TS 2.0. It's a free app. You can put it on your phone, and it has all of the TeamSTEPPS tools and the different ways that you can learn more about TeamSTEPPS. I'm going to turn it back over. Just let me go through this, and then we're going to go back and I'll have Suzanne dig into the chat. You guys are such a great group. So the next steps for you is get an entire training and train your team. Start small. You don't have to transform the entire clinic, but if you guys don't have a really tight, brief huddle and debrief, you might choose one of those to plan, do, study, act, and implement that. You use the TeamSTEPPS tools you've learned today, or really hone them. Participate in those briefings. People say, oh, we don't, in my clinic, when we first started doing huddles, the providers all said, oh, we don't have time for that. We don't have time for that. And pretty soon, when it became part of a culture, you were really out of step if you didn't go to the huddle, because you didn't know what was going on for the day. And so people made it their business to get to the huddle. We used a nice checklist so people knew it wasn't going to be drug on forever, and they could get to see their patients in a timely way. And, use the new attitudes and knowledge and the behaviors immediately. It would be a fun thing to go back and have your team do a Smalley exercise, and know that it's not scientific or anything, but it just gives them a little insight into themselves. Some people might not even feel comfortable sharing it publicly, but for them to know about themselves that they really do secretly like to be the leaders. And then use the key tools whenever possible: SBAR, situation monitoring, and mutual report. Think back to that. Maybe even when you get these slides, you might want to show one of your teams in a staff meeting. If you don't think that mutual support is something that folks are doing, maybe you show the video and just remind people how we take care of each other. I know it's harder in COVID, but that's coming to an end. And how do you do staff meetings? Are they online, or how are people checking in? I'm going to turn it back to you, Suzanne.
Yeah, I think this is a very creative group. I love your ideas, Karen. And I think, thinking about ways, I think if you can really prioritize building psychological safety, that I would think would be really a #1 thing to do. And these tools do allow you to structure the communication that you're having. And in that regard, it feels much safer for people. So getting good at it, really using them as almost templates in the way that you're going to communicate. Co-creating, what's our huddle going to look like? What are the essential things that we want to make sure we include? Co-creating and co-developing, what's our debrief going to include? What do we want to make sure to cover? Those, I think, are really good ways to engage people, and then they know what to expect. They've had a role in creating those tools, and I think that they're much more likely to be adopted. So
very good.
Yeah.
Next slide. Let's go to that next slide. So this is another poll for you. Some of you guys are already doing this, and I think, Chelsea, we probably should have put multiple again. So what we could do here.
I did on this one.
Oh, you did? Okay, look at you. She's thinking ahead and moving ahead. So you guys go ahead and tell us, which of these are you willing to commit to?
I just launched it. Looks like we're getting some responses.
Okay.
Give it a few more seconds here.
Mm-hmm.
All right. If we want to go ahead and wrap up, I'm going to end it in 5, 4, 3, 2, 1.
Michael, that's correct. TeamSTEPPS 2.0. Okay. Well, this looks great. Huddles, debriefs, and mutual support popped up. And then you're going to get trained. 33% said they're going to get trained. That's great. You're going to use the briefs, situation monitoring. And then somebody said, other people said something else. Tell us what the something else is. This is great. Tell us what the something else is. No, no takers? Okay, well, if you want to tell us later, maybe you can tell us in the evaluation. Thank you so much. Next slide. So here we have an evaluation. We're gonna launch this for you. I just wanted to open it up. I think we're gonna get out a little bit early. There's no point in belaboring this. You guys work really hard. It's hard to be on all of these Zoom calls. So today, you really were the first time we've done this with virtually. And I think what we would do is shift some things from the morning into the afternoon. But it's okay to let you out early. It's okay to take some time for yourself. I'm fully aware of that. So let's go ahead and open it up. If anybody has a question or something that they want to say, a comment, thank you so much, Matthew. Something that you're thinking about for your clinic, or you have a question that you want to ask Suzanne or myself, this is the time to do it. And if not, please, let's just launch the evaluation.
And I'm thinking, wouldn't it be great if they used the extra time to do the evaluation?
Yeah, let's just do that. Let's open it up and do it right now. That's great.
Yeah.
I don't want you guys to leave because I know what happens.
Yeah.
The wine starts pouring, the kids start calling, all kinds of stuff happens. Thank you guys so much. You've been a great group. Very, it's hard to be in front of this box all day for sure. You see Celeste has something for us, Suzanne.
Celeste is writing, oh, this is great. In residential over the last 2 years, there's been many changes to programming, including trauma-informed care and now co-occurring blends, trainings, evaluating current systems and streamlining and or digitalizing more documentation, email groupings. This is so much, Celeste, that are vital to receive categorized information, buy-in activities, forming work groups to develop new program deliverables, instituting supervision, clinical supervision, supervisors quality circle with leadership, readings, boundaries for leaders, integrity, the courage to meet the demands of reality and the addicted organization, et cetera, just to start. You know, what a commitment, Celeste. That's, I mean, when I read that, I just read tremendous commitment. So, and I would say, and this is something you've probably heard, that it's a great example of being a learning organization, right? Of being an organization that continually challenges itself. I don't know if that was your other, but those are fantastic others.
It was my other.
All right. Jess
I
is
also see change fatigue. I know I say a lot of stuff. So when you have an organization that's pro change all the time, sometimes you have to monitor it because people, you know, none of us really like a lot of change. We say we do until we have to really change ourselves. So yeah, got to monitor. Go ahead, Suzanne.
Jess mentions she private messaged me, but I think she meant it for everybody. Trying motivational interviewing, right? Trying to kind of work with folks to really understand how she can improve their interest and their motivation to learn, as well as, you know, whether or not, you know, to keep a client in treatment. I hope I got that right, Jessa. If I didn't, I'm sorry. Oh, AMA Steps Forward. Rachel's using AMA Steps Forward to train staff in our team-based clinic. Very nice. That's a great one, and she includes a link, which is very generous. Thank you, Rachel.
That's nice. We have to make sure we save our chat.
Yeah, our chat. Yeah, for sure. Chelsea is saying, please don't forget to take the evaluation.
Yeah, is there a way we can just give 5 minutes and open it up and have them complete it right now?
So you all can click on your, you all can click on that live link, and that should get you right there.
Yeah, let's just take 5 minutes to do that.
And Mark already did his, so
he did. Okay.
Thank you, Mark. Yeah.
Thank you. Done. People are doing it.
Great,
Okay.
great. Teresa finished before Mark.
So I think that's great.
Yeah. Great. Mark doubts that Teresa finished before him.
Well, as you guys are doing that, I'm just saying that we're probably going to be giving you 15 minutes back of your Friday afternoon.
Yeah.
It's been a pleasure with you today.
Yeah.
I've learned a lot. I hope you've learned something new.
Yeah.
Just to have a great day, to relax and to think about your work. And I'm hoping that on your 2-hour break, you didn't have to do work, that you were able to spend some time in the sun if you have some beautiful weather up there. And I'm hoping to see you again soon in other venues or avenues.
Yeah.
If you have other questions, please feel free to reach out to us. Greater Columbia knows how to get in touch with us. And so I think we can end it. How many do we don't know how many folks have actually, you'll mail it out with them to Chelsea in case they didn't get a chance to complete it. But I think this is wonderful. We had a great day. I want to say thank you so much to my colleague, Suzanne. And I've enjoyed you guys a lot today. This has been really fun.
Yeah, same on my end, Karen.
Yeah.
It's been really great. You guys are a very experienced group of leaders.
Yes.
And I'm really confident that you're gonna implement a lot of important things with your team.
Right.
So
I think it's good. And I'm sure you're doing strong work, and I want you to be well, stay safe, and let's push through this pandemic and get to the next phase. All right. I'm going to say goodbye now. And
bye, everybody.
Perhaps
Have a wonderful
why don't Greater Columbia and HMA stay on, and other folks hang on.
Okay, so we'll stay. Okay.
Thank you. Yeah.
Okay. You all take good care.
Thank you. You guys
have a great weekend.
You guys take care.
Thank
Be
you.
well.
Thank you.
Okay. Bye-bye. Thank you. I think they're signing off now so that we can.
Yep. And there may be, if we have people that are still kind of hanging in because maybe they walked away for a minute, it's possible, Chelsea, that you can invite them off.
Yeah.
Yeah. Let's start doing. Give me a few moments.
Yeah, that's fine.
Is the 529 number, is that anyone on any one of us? I don't think it is. Okay.
Is it Diane's? Diane, is that you?
Maybe she logged off.
Must have.
Okay, let me.
Chelsea, I meant to say this out loud, and then it slipped my mind when I started worrying about saving the chat. I really think you did a great job today.
She did an excellent
I really want to thank you for that.
bravo.
Bravo.
This is a hard job to do. It's hard to be in the back scenes, and I feel, every time I've ever done one of these, the producers are going crazy in the back, but it's seamless for us. So how was it for you, Chelsea?
Fortunately, we do trainings like this every month, and so this wasn't too bad. This was probably one of the more where we had more videos in the breakout room, so it really tested my skills, but I felt like it went pretty smooth on my end. I mean, I think we could have done the breakout rooms are probably the toughest part, but I think it went really well.
Yeah, I did too.
It did not, I mean, I'm sure you were like, working very hard back there, but it seemed to go seamlessly.
It was seamless. It really was.
Yeah.
Well, what did other folks think? This is the first time we've done virtual, and I had the technology snafu at the beginning, but what did you guys think?
really liked it. I loved how interactive it was. I think that helped keep people engaged. So like the polls and then the videos, I mean, just kind of mixing it up, and the whiteboard, I just think it was fun, and it just kept them engaged, and it made it more interactive. So I feel like they maybe got more out of it because they were actually participating.
Well, it was interesting because, you know, after lunch, we had 62 people who came back.
Yeah.
So that
was my comment. I would say usually when we have a break, even if it's 15 minutes, we lose, about a good 10 to 20 people, but we only lost about 10 people. And I was really impressed after 2 hours.
Yeah, we had some people who dropped off later in the afternoon, but kids are getting out of school and other things are happening. But we had a majority of people who stayed on. In retrospect, Susanna and I talked about this. What I would have done is, when we sent out the needs assessment, and we got good, valuable information from that too. It might have been more valuable to find out what communication skills they were using, because everybody seems to have been using some form of a debrief or, huddle or something like that. But there probably were other things that they weren't using. And so I didn't ask that question, and it wasn't in the needs assessment, but I think in retrospect, that might have been more useful if we had introduced the CUSP and the 2 challenge rule and how given them a nice format for sort of feedback and to help settle disputes on a team. So that's some information for Susanna and I.
Good follow-up. Also a follow-up for you guys to know that
for them, because they might want that. Wes?
Yeah.
Well, I was going to say that as part of our practice transformation process, the majority of our organizations are in year 2, and one of the milestones does require them to do a daily huddle. So they should all be familiar with that, which really makes this process meaningful to them, to add a little bit of nuance and to extend that, to use, different types of methods to conduct that huddle. I think it was real useful. Personally, we've been using the SBAR format going back for at least a year or 2. It was introduced to us by one of the other accountable communities of health. It's an administrative SBAR rather than a clinical one.
Sure.
But we've adapted it and really like that format, and being able to present the board with meaningful information behind making a decision, which is part of the recommendation section.
Right. And that it's not too drug out too. Sometimes people tell you, it's 45 minutes of explanation when you're like, okay, just tell me why you did what you did or what you need me to do. Right.
Right. Those videos were really good. I like Doug's video about the Blue Angels.
Yeah,
that was really
great.
spot on.
Yeah.
I just think having some examples of all those different models is really helpful, whether it's a video or a static visual model. All that I think helps embed how to use that model. In particular, I learned by example. So having those really helps.
Yeah, well, good. Martin, were you going to say something?
No, I was just going to mention that my group was a little quiet after we came back from lunch. So, on the Fantasia scenario, it was just kind of, hey guys, what's the name? So I kind of took a bit.
Yeah.
And it was less talking than the first scenario. But I mean, they did well.
Yeah, sometimes, after lunch.
Right?
Yeah, it's a long day. They've had a big burrito at lunch. They're actually ready to go to sleep now. So
Friday afternoon too. It's it can be challenging, but again, this is worthwhile material for everybody.
Yeah, it's good. Brissa, Samantha, you have any?
No, I just thought it was. Oh, sorry. Sam, go first. No, you can go ahead. Oh, okay, I was just saying, just like Martine, me and Brittany and Sulamita were in the same team, and it was a little quiet, but I think we made that connection, or we encouraged everyone to participate. It did take a little bit, but I think, like you said, it's just end of the day, people have other things coming up. But other than that, it was good once the conversation got started, they were more on the quiet side.
I think it might have had to also be the scenario. Because I think people were like, I don't even, because
Yeah.
well, you were on that one, Bressa. It was really funny because they were kind of like, it's almost like they didn't even know where to start with it because they're like, space travel, what?
Yeah, but see, that's part of, see, this is the thing, is what part of what we like to try to do is to teach learning, to learn and learn new skills in a different way, rather than the old-fashioned didactic where we stand in front of you and just tell you this is how you do it. So sometimes people think, you know, if I had been with you, if Susanna and I had been with you and we had been with this group, you know what we would have had them do? We would have had them sit at tables and make a paper chain with tape and paper, and who can make the longest chain. You know, I can't tell you guys how competitive people get and how creative they get about making a paper chain. But what it teaches is how, through this very simple childhood game or thing that kids do, what it takes to make a team work in a project. You have to have a leader, you have to have somebody who cooperates, there has to be somebody who's managing the supplies. And so we had to come up, that's what we did with our space thing. And once we sort of said, okay, we're just gonna have fun with this, hey, the techies came out in my group and, oh, we're gonna have, they didn't even say it in the debrief, we're gonna have somebody so that nobody's stealing all the food. It'll be just like Star Trek where you go and put your eye up there and it'll tell you how much water you can get and how many pieces of bread you can get. So it was kind of funny to sort of see them thinking that way, even with the tools and the rules and all of that. So yeah. All right, well, anybody, go ahead, Martin.
No, I was gonna say I agree with you on that, Karen, because that Fantasia scenario, it really threw them off because they were thinking, you know, from coming up from the first scenario, it's all clinical, you know, dealing with something that, you know, we're all dealing with. They were just kind of, oh, hey, we can do this, this, and that. Whereas this one, it was just kind of like, oh, well, you know, we're thinking more clinical rather than kind of thinking outside of the box, you know.
Right.
But I like that scenario because, you know, that happens in primary care and hospitals and behavioral health, substance use, skilled nursing facilities, and all of the settings that we have. You know, it's nothing always the same. There's, you know, different people with different scenarios that we have to adapt as, you know, we face those scenarios or those issues.
The goal is at the same time we have a lot of the same skills that can translate, right? Where we can be in a really different environment. We thought about this a lot during COVID, at the early days when everything seemed to be so different and turned upside down. And we kept having to say, but there are the same skills that we still need, like motivational interviewing,
right?
And, you know, things that really keep us connected to our clients, assessing, checking for, you know, SDOH needs. It's not all different, you know, maybe the delivery system, telehealth or something is super different. So
but essentially the work is the same.
Yeah, it's good to know. I mean, it's good to think about different scenarios, but we have these core skills.
Yeah.
Yeah.
Well, it's Friday. I'm going to let you guys go. I love working with you. I hope to work with you again. And so be well.
Yeah. Be well, everybody. Take good care.
And I'll let you know, I'm going to write up just a one pager about today and then send to you guys a copy of the results of what folks said about the trainings. Okay.
Good.
Great. All right.
Awesome.
Take care.
Thank you so much. Have a good weekend, everybody.
Yeah, you too. It's really fun working with you guys.
Okay. Bye-bye.
Yeah. Bye-bye.
Bye.